I probably look a little bit different today. No makeup webinar, so much more casual. Heather is joining me, as you can see. So we are kind of splitting the duties of hands-on. So my name is Kara Moncrief. I'm the Clinical Communications Director for Viora. I really hope this isn't the first time that we're meeting because I have no makeup on. But all of you have probably met us multiple times. Okay, so today is going to be hands-on with VST, and then additionally contouring with the V-form, which Heather has figured out a way of showing that, which is amazing. My challenge today, and I'm going to try to do it, is hair removal with the IPL. So when Heather's doing the contouring with the V-form, I'm going to try to kind of figure out a way of maybe like putting the computer on the floor, me sitting on the floor, somehow working it out to where I can show you hair removal, because I actually have never ever done hair removal on my legs. I know that sounds probably crazy to you guys. It's probably the first thing that you guys ever did was hair removal. I never did it. So that's a good thing, because on these webinars, I actually have hair to remove. So we will try to figure that out for you guys. Okay, so, oh, and then Heather, I'll introduce her. She is one of my clinical trainers extraordinaire, and she owns her own med spa. So it worked out really, really well, because she was actually able to go to her med spa where she has the systems. And I think that's your backdrop for before and after photos. Am I correct? Yeah. So there, that just shows her personal backdrop for before and after photos. It works great for filming as well. Okay, so got my coffee. What we're gonna do, and Heather, I'm kind of talking to you, is I think I'll start with the VST on the eyes, and we can just talk kind of together, because I know there's going to be some scenarios where it's just going to be hard for me to keep talking as I'm doing the treatment. So you can just keep talking about the treatment, you know, what it does, why we're doing, you know, certain things like cross hatching, whatever, and okay, we'll be able to talk together. A big one is when you're doing your lips, the PlumpRF, I'll be talking throughout that whole treatment, so you don't have to, of course. Okay, so we'll get started. Heather, if you want to say hi to everybody, I'm just going to grab my my supplies.
Okay, great. Hi, everyone. Excited to be here. Feels good to be back in the office for a day. Kind of cleaning and getting stuff set up before this. So I hope you guys are all doing that too, getting ready. I'm going to do my best to show you guys contouring. Obviously, I'm by myself. I'm going to do my abdomen. And so I'm going to kind of set everything up when Kara, when you're doing like that, probably towards the end of your eyes. Mm-hmm. Or should we do lips first? Probably, right?
Yeah, sorry, there's something weird happened to my computer. So we're going to do eyes first. So you were just right under me on the computer, so I could see you really well. And yeah, you, for some reason, jumped all the way down on my list, so I can't see you anymore. So let me, I can't spotlight your video though, because then when it records, they won't be able to see me.
Right.
I don't know. Actually, here, I'll just, I scroll down, I can still see myself, and I can see you at the bottom. So we're okay right now.
Okay.
All right, so for the eyes, we'll start with that. Just remember, you're using a tongue depressor to apply. If you guys are joining us from overseas, you may not have these. You may be able to order them online though. So if you don't have these, then you guys have like your own spatulas that you can use, but something like a tongue depressor to where you can smooth it. Oh wait, where'd you go, Heather? Shoot, you keep jumping at the very bottom. So when people jump on, you go, you fly down at the bottom. Let's see, someone, hi, Heather and Kara. Hi, guys. Hello, good to see you guys again. If anybody knows how to figure this out, why Heather keeps shooting down at the bottom of my, oh, and write in, can you see both Heather and I? Because that's going to be important. And another thing.
Yes.
Oh, they can. Okay.
Yeah.
And are you guys seeing everybody? Like, is it in, that's the thing, we don't want it to be in gallery view where you just have, you know, there might be 40 or 50 people on the webinar and you have all of those boxes up. So we want you guys to be able to see Heather and I well. So I can't remember, I think it's pinpoint speaker. I think that's what you
just not. Oh, well, the only problem about that is that when you're doing the hands-on and I'm talking, they're not going to be able to see you. They're going to be seeing me who's talking, right?
I don't know. If anybody knows, if anybody has like a clear view of both Heather and I, or at least know how to pinpoint who's doing hands-on, because that's really the most important thing. You'll be able to hear Heather's voice, but then watch me. So if anybody has any suggestions on how to make sure you know how to enlarge us, write in. Okay, so I usually start under the eye. Today I'm not going to. And the reason being is I'm really, really sensitive right here. Everyone is really sensitive right here. So I usually have to turn the energy down low to treat right here in this corner. I can treat from here out at a higher energy. It's just here in the corner. So what I'm going to do is I'm going to do above the brow. It doesn't matter where you start. So I'm going to do above the brow first, then I'll go below the brow, then I'll do crow's feet, then I'll finish from here over, and then I'll turn the energy down and just do that corner. There you go, Heather. You keep shooting down. Screen is on Heather, not Kara.
Let's see. Can we spotlight you?
Up here it says cancel the spotlight video. Let me just click on that and see what
happens. About putting it on spotlight on you?
Okay, so I just clicked cancel the spotlight video. Now screen is on Heather. Okay.
I see you.
You do?
Mm-hmm.
Okay, so since I canceled the spotlight video, let us know what you guys, screen is on Heather, not Kara. Now I can see both of you. Now screen is on Heather. Okay.
Cara, I can see you and Heather's above you in the little box.
Oh, okay. Perfect.
Right now. Oh,
and did you click on something to make it that way?
No, I think it's when you were clicking on. So you're right in the big screen now and Heather's up in the top. So Heather, talk for a second and see, does that work?
Okay, so
when you start speaking, you're now on the screen.
Shoot.
Whoever's speaking becomes large on the screen.
Yeah, exactly.
Shoot. Okay. I'm going to try something. I'm going to spotlight my video. Now can you just see me? And Heather, talk.
Okay.
Yeah, that's cool.
Perfect. Yeah, okay, so then you'll switch it when we switch.
Okay.
Perfect.
So
okay.
Heather, thank you guys so much. So Heather will still be able to speak, but you'll still be able to see me. Then I'll spotlight her video when she does her hands-on, and I can still speak and you guys won't have to see me. Okay, great. So we'll start above the brow, below the brow, crow's feet, and then under the eye. Remember to always split it into 4 sections. That's so very, very, very important because it takes a while to go around the eye. So if you try to do the full eye in one pass, you're losing so much heat where you first started. And I'm going to start right there in the glabella. Remember, a thick amount of gel, and you're always using clear ultrasound gel, and about 2 millimeters. It's about the thickness of the electrodes, maybe a little. I usually start out a little thicker just because we lose so much. And let me get my hand mirror. So I can see what I'm doing, because using the camera on here is not the smartest thing in the world, because I'm going to end up probably doing
so starting off with a good amount of gel really will help you so that you don't have to keep stopping and adding more gel. You're going to continuously add more gel should you need it, but if you start off with a good amount, then you can kind of build up that heat without adding more gel.
Exactly. Okay, so I think it'll be fun if we kind of quiz people throughout hands-on. So you guys can unmute yourselves or write in what mode do we always use for the eyes?
3.
Hi.
I think she said it.
3.
Oh, I thought she said hi. She said 3. I'm like, hi.
Hi. Hi, Joe.
Yes, mode 3, very good. And what energy joule is a good joule to start at for titrating up?
60.
40.
40,
60.
very good. Who said 40? I wish I could throw prizes.
So if you notice, Kara is using about a 10% overlap. So really just right next to the last pulse. She's
So
doing
I
nice pressure.
Yes. So pressure is key. And you know who the best person at pressure is? And the only person I'll let treat me is Heather. She knows her pressure. And the more pressure you have, the more comfortable the patient is. So I'm pulsing 4 to 5 times, and then I'm titrating up 10 joules each time. So I'm already at 62. I start at 42 usually. So I was at 42. I pulsed 4 to 5 times. I went up 10 joules. Then I was at 52. I pulsed 4 to 5 more times. I'm at 62. And what's the energy when you actually start asking them their heat level? Anybody?
Where
Okay.
do we get clinical efficacy?
Yep, there we go. That's what I was gonna rephrase it too. What joule do we need to be above to start to get that efficacious treatment?
Oh, we got it.
What'd you say? Or he say?
60.
Very good. So this is when I would then start asking the patient, how much heat are you feeling? It's right when you get to about 60 and above. So I'm feeling a 1. And now I'm at 72. So I've pulsed multiple times. So I'm going to go up to 82. And I would ask the patient again after pulsing a few times what kind of heat they're feeling. And I'm not going to do both eyes, you guys. I'm not even going to do all passes just because time-wise, and it would be super boring for you guys. But I will show how to do it. Okay, so now I just finished my 2 rows. So you'll start in the glabella because I'm Botoxed right now, but if I wasn't, I'd be creating a line right there. And we want to help the glabella line as well as lift the brows. So 2 rows is plenty to lift the brow. When you're done with each pass, you're gonna smooth the gel. Think of it like icing a cake. Don't take too much time on it, just, and now it's smooth. Make sure it's thick everywhere as well. And we're gonna wipe, it's great that I have a rolly chair, but it kind of gets out of control sometimes. It starts to roll all over the place. So we're gonna also have a piece of gauze and we're gonna wipe the tip, the electrodes. Do you want to tell them that trick on how to remember the passes, Heather?
Sure. So especially when you're first starting out, or I mean, this is good practice to do all the time because we start to get talking to our clients, and we get really comfortable with the treatment. So we start to talk to them, and we can lose track of how many passes we've done. So a good trick is to have 4 to 6, depending on how many you're doing. I always do 6 pieces of gauze next to you on one side of the client. I usually stand behind the client too, just to let you know. I find that easier if they're laying down and I'm behind them. So on one side, let's say the right side, I'll have 6 pieces of gauze. So after every pass, I'll take that piece of gauze and I'll wipe off the electrodes and I'll throw it away. So you'll know that once you're out of gauze, you're on your last pass.
So I've been titrating up still. So I've still been pulsing 4 to 5 times and then going up. Where I stop jumping by 10 joules is when I'm at 82. I don't go 82 to 92 because it's quite a jump. So I went 82 to 86, and then I went 86 to 90. Now I'm at 92, and I'm still really comfortable. It's just very slight heat. And remember, it's because I'm using a ton of pressure, so it's tricking the nerve. Something else that you may have noticed is that I've changed the direction of my electrodes. So now I'm going horizontally, where before I was going vertically. So you're gonna do that after every other pass is crosshatch. So I'm gonna do one more pass up here, and then we'll move on. So
you notice she's getting really, really light pink to her skin, but it's not red, it's not angry. It's just like a healthy, nice pink.
And remember, with radio frequency, it's dependent on time and temperature, right? So the time is really the zone size, your zone area, and the temperature is making sure that your goal is to be above that 60 joule range. But, and I talked a lot about this in the didactic videos, it is based on time and temperature, but if you are not seeing any type of pinkness to the tissue and they're feeling no heat, you're not going to be getting to that clinical endpoint that you're needing. Can you guys see okay? Am I okay?
Yeah,
in that? Okay.
Notice how close her pulses are to each other. That's really important. That's something I see a lot when people have been doing this a long time. They start to really spread them out, and you're really, really reducing the amount of heat that's going into the skin when you're doing that.
Yeah. All right, so we'll just do 3. Take that off. Okay, so you guys, I love when we do these hands-on webinars. I love that you guys unmute yourselves and ask questions, like any questions that you guys may have. And by the way, it's never a dumb question, never, never, never. So do you guys have any questions so far?
Are you using
Or
foot
above
pedal?
the brow. Would you lift up with the handpiece at all?
Yeah.
Okay, yeah, you answered that because I didn't fully understand the question.
Sure, I think this is what you're asking. We're gonna do bunny hops to the next spot. You're not gonna drag it. The reason why is when you drag it, there's not gonna be any gel on that next pulse. So if you drag, like kind of like a snowplow, that next pulse will not have any gel underneath it. So when you pick up the handpiece and place it on the next spot, it'll have adequate gel.
I like your analogies.
More like if you're trying to achieve more of a brow lift, like if you're trying to actually pull up the skin.
Oh, okay. So no, when you do these 2 rows above, there's no need to pull because, I mean, there's just no need because really heat is what gives the brow lift, right? So we're just making sure that we have contact, we're staying on the skin, and we're building heat for a brow lift. Now here under the brow, you'll see me pull.
Right, when we do under the brow. Okay, so but there's no really efficacy to do it above the brow.
No, there's no need. Yeah, exactly.
Okay.
Yep.
Okay. Thank you.
Yeah, of course. Thank you for unmuting yourself and asking.
Are you using foot pedal?
I'm not. You can. I'm just.
I can't see any trigger. It doesn't seem like the trigger moves, but you must have it.
It's just the trigger is on the ST is so light to the touch. So that's probably why. But yeah, I'm just using the trigger.
Thank you.
Yeah, of course. But it's such a light touch, which is nice because then your fingers don't hurt after. Sorry, I was sitting Indian style. My legs are going numb. Hold on. So.
I always tell people when they're first starting out, say this is like your first time seeing the ST, to trigger in the air before you pulse on the skin because it is such a light trigger. So when you pulse it in the air, it kind of just gives you that feel for it, that it is such a easy to trigger handpiece.
Yeah, that's good. I never do that. That's great advice. Okay, so now I'm gonna really remove the gel that was above the brow well. Usually I use a baby wipe, but I'm just using a piece of gauze to dry it off really, really, really well. And the reason being is because I'm pulling on the next one. And why are we pulling? because I never want to pulse on my eyeball, right? I want to pulse on the bone. So Heather, I'll probably have you talk through this one just so I can concentrate on this.
Sure.
Let me figure out where to put my mirror here. How do I pull and have the mirror? And I'll try to use the camera on the computer.
So notice she's using a gauze to pull up her brow. That really helps you to get that grip that you need.
I just turned the energy down, by the way. I was at 92. I went to 82.
And she's just right underneath that brow. And also notice that she's changing where her other hand is on her forehead. Because if you pull just from one spot, you're not going to get that lift, that same amount of lift as if you move along your brow. So now she's at the tail end of her brow, so her other hand is close to the other end of her brow.
I'm going to try to show the scoop.
Okay.
I got to do this upside down. I always say hands-on webinars would make for really good but bad TV.
So she's pushing down, she's placing, then she's scooping, scooping with those electrodes. And this is to get that, the hooded skin above below the brow, above the eye. That's really hard to get at. So she's scooping the electrodes and pointing them away from the eyeball.
And I'm making really weird faces with my mouth. It's like when you put it's like when you put mascara on and you're like, why do we do that? Okay, I'll show another pass here. By the way, this is the only area that I don't cross hatch. Heather is really good at going horizontally on the under eye, but most people are not because you're to the point of teetering on the bone. It's also harder to scoop sideways for me and most people. Heather's really good at it though. So if you're good at it, cross hatch. But really, there's no huge need for cross hatching here. You're not going to miss any of the tissue. It's such a small area. So first row, remember, we're right below the brow.
We really are cross hatching just to make sure we're not missing anything. So underneath the brow, it really isn't necessary to cross hatch. I agree. Especially that second line, second row.
So I was pulling here, and then I was pulling here, then I was pulling here, like Heather said. I'm going to try to scoop without turning this upside down. Nope.
And on some people, I can. Some people that have like a higher brow, which you do, but it's probably just hard to do on yourself too. But when they have a lot of that hooded skin and a very short space between their brow and their eye, I can't do it either.
So what I'm trying to do, now remember you guys, I would be sitting behind them. So I'd be laying here and I would be sitting here. So naturally I would have the handpiece like this. So that's when it's easy to do the scoop, when it's upside down, but it's just hard to hold this upside down and do it on myself. So this will be my last pass with it. So I just want to show you, we push down. This is all this hand does is pushes down. That's it. No more. Actually, I'll do it without the gauze so you can see. So all it does is push down. And why I'm doing that is, you see when I push down, I get a lot more tissue. So it helps me scoop it up. Donna, do not take photos of me right now for Instagram. Okay, so pushing it down. So I'm getting the row all the way below where I just treated. So the first row was just right under the brow. Now I want to treat all of that. So you're scooping up and above. Don't scoop below the brow bone, but you're scooping up and above the brow bone.
And then with her other hand, she's putting pressure down still so that it's electrode, the tissue, and then your hand kind of putting that that pressure on the other end of it.
You guys have any
But notice
questions?
it's away from the eye. It's not towards the eye.
You guys
It
have any-
actually does not hurt either. A lot of people think that
No.
this is like scary and it hurts. One thing I do like to show people though, the client that's on the bed, is that if they should feel a little bit of pressure on their actual eye, it's not the electrode, because when you're scooping, the little plastic part can kind of brush against their lid. So I do like to show them that before, that it's if they feel anything, it's just the little plastic part of the handpiece. It's not the actual electrode.
But try to get away from that, because I've been at trainings where I'm training people, and this is what they do. They end up over correcting, like over, how do I say this? Okay, so
I hear you mean, like going too,
Uh-huh.
taking too much.
They
Yeah,
go,
right.
and then they lay it on the face.
Right.
So instead, you're doing this, and you're lifting up. So look at how far that handpiece is away from my eye, the white part. So push down, scoop up. So far. Push down, scoop up. So try to get away from, because a lot of people do go like this, and then they keep going and going and going and going and going, then it's laying on the face. So try to get away from that. When you get back into the office and you're practicing, you're scooping up above the bone instead of going like that. Scoop up instead of whoosh, scooping kind of down.
Look at how much higher your brow is.
I guess I'm gonna have to like fully do it when we're off the webinar. I get lazy, you know. We have all these hand pieces and you get lazy doing it. I've actually been much better since we've had the time at home. I've actually been a lot better at giving myself treatment, especially like for my overall skin, like microderm and IPL skin rejuvenation and all of that. Okay, so now, sorry, the gel's kind of in my eye, but any questions on what we just did? That's usually the most complicated, is learning that scoop under the brow technique. But of course, you have this webinar that you can always go back to and watch, refer to when you're ready to do the treatments. I feel like it's really in my eye. All right, so now we'll go to the crow's feet area. Oh, we got a lot of people on today. You know, the hands-on brings a lot of people to the webinars. It's kind of what everyone needs. Okay, so now, let me get my mirror. Now we're going to do the crow's feet area. I did not wash my hair today for that reason. I knew gel would be in it.
So notice how close she's getting to the actual eye. Nice and close. I also when I'm doing trainings, I like people to kind of feel their eye and to feel how far that bone goes, because again, we can treat all the way to the bone. So we can treat really close to the eye without being in that ocular zone at all.
And I like to have them smile. I'm Botoxed though, but I can still kind of see my skin moving of where I would create Botox. I wish I could create Botox, where I would create crow's feet. So if they're not Botox, it's really nice and easy to see where their crow's feet are.
So what Kara means is that sometimes the crow's feet come out straight from the eye. Sometimes they're more like down the cheek, and then sometimes they're up, and then other times they're, you know, that whole zone. So you want to follow that with your electrodes, and that's your zone.
Let me get comfy here. Okay. So it doesn't really matter. It's usually kind of a perfect square here, so it doesn't really matter where you start. I like to work out my first one, so I'm going to start really close. And if you guys feel on yourselves, your bone comes so close to that orbital ridge that that's the positive, that you can get all the way to here where you can't Botox here. we can Botox out here for crow's feet, but then you still have these little fine lines. So this can get all the way to that tissue without it being a risk. Oops, sorry, it went on standby.
So again, a 10% overlap.
I put it down here. And then for extra safety, I just pull it out a little bit. And pick up where I left off.
The client might feel a little bit awkward with you right next to their eye, so that helps them to not be so nervous. It doesn't hurt, just people are a little nervous when you get close to their eye.
Mm-hmm. Yeah, it does. It feels awkward, especially with like the VFR, because with the VFR, the tip is much larger than the ST, of course. And with the VFR, we can treat under the brow and under the eyes. So that's really when like plastic is and vacuum, the vacuum can suck your eye. So it definitely
Sarah?
scares them. Yeah.
Sarah, are you still on 82?
I'm still on 82, yeah. And I could actually go higher. I'm like at a 1 or 2 right now. I could probably be at 90 and be fine. I'm just not doing a full treatment, so I didn't go up. But yeah, let me go up to 86. There we go. Okay, more gel because it was looking thin. So if you ever question, is there enough gel? Just add more. It's better to have too much than too little. Always keep an eye on your electrodes. Is there too much gel accumulating on them? There's not much, but I'll just do a quick wipe because you don't want your electrodes to overheat, right? Okay, so now I'm gonna cross hatch. So I just went vertically, now I'm gonna go horizontally. Use my mirror.
Maria asked how many rows under the brow? 2. And yes, Kara did 2 vector rows. However, some people with really, really high arches, you can do 3. So whatever fits under that brow is how many vector rows you're gonna do.
Yeah, and some you can only get 1.
Right.
If I were, you know, 30 instead of 39, and I didn't have any excess skin or hooding, you probably would only be able to do 1 on me because someone without excess skin, you're not gonna be able to get that scoop. So younger clientele, usually it's 1. When you get into like your 40s, 50s, and 60s, it's usually 2. And then, you know, some people in their 50s, 60s, 70s, you can sometimes get 3, like Heather said.
Anatomically too, sometimes people's they have like a very short, like some men with a bigger brow, you know, they have such a small space between their actual eye and their brow, and so you may only be able to get 1 or 2.
I'm gonna do 1 more, so I'm gonna cross hatch the electrodes, but I'll cross hatch the whole area too, because you guys can go in the opposite direction and change the direction of your electrodes, so I'll show you that. I usually work medial to lateral just because it keeps me organized, but you can absolutely, let me wipe the electrodes.
The one thing you don't want to do is just keep switching that, because you will, like Kara said, you'll get unorganized and you won't remember where you're at.
So if you want to go vertically with your electrodes and vertically with your pass, and then horizontal and horizontal with your pass, you can do that too.
For some reason on the side of the eye, I find that easier.
Yeah, I usually, that's why I thought of it. I usually do that.
Are we able to treat people who have had threads around the eye area?
No. You can once the thread dissolves.
If there's sugar threads?
Sugar threads. I don't know anything about sugar threads. I only know PDO threads.
Thank you.
What is sugar?
The sugar ones are the ones that dissolve. The other ones are like a surgical suture.
Well, PDO threads dissolve. The threads. PDO
They all
threads
do?
dissolve. They all do.
Okay.
Unless
And
they're
there's a new.
even, it's like a suture, but it's dissolvable, like a dissolvable suture. So PDO threads dissolve, and it takes, well, it depends. It depends on the company. Some companies, it
Right.
takes about 6 weeks for it to
Okay.
dissolve, and then you can go in and treat.
Okay, so if they're not dissolved, we're not treating.
Yeah, otherwise you'll dissolve them with the ST. You know,
The heat will. Okay.
exactly. But you know, some of our offices have had to use the ST to fix threading issues. So if either you did the issue or some other office created the issue and they have puckering, or they inserted the thread too superficial and you can actually see the thread coming out of the skin, they'll just pulse over the thread a few times with the ST and you'll see it just
Relax.
fall.
Ah, nice.
Yeah.
Okay.
So that's off protocol, but something that some of our offices have done just to fix issues for sure.
Okay. Okay, thank you.
Yeah, you're welcome. All right, this is the part that I dread, is under the eye. It's the only part I'm sensitive to. Not from here out, but boy, oh boy, from here in, I have to lower it to like 60 on myself.
Everyone is so different with sensation with ST, even in different areas. I've found that that someone that's, I can IPL nice and high and they're completely fine, then that sensation does not bother them whatsoever. However, the ST in certain areas might really, really affect them. So yeah, it just depends on the person and their pain tolerance, but also the sensitivities, then the nerve endings are just different.
I'm fine. VFR, I'm fine. IPL, I'm fine. ST in the corner of my eye, I'm not fine. So sensitive to it. We have 2 participants raising their hand. Do you want to unmute yourself and ask the question? Otherwise, we can look at the chat. Okay, so let me get some more Gauze here. Everything's so far from me because I'm in my office and my way I had to set everything up, my desk is way over there. All right, so I'm gonna come down to 82, see if I'm okay from the mid out. I'm gonna work first low and then up here. And I need to pull, so I'm not gonna be able to hold my mirror. So I'm gonna do it in the computer camera. Okay, so I usually do first row right under the eye, so I'll show you guys. So first row, I'm not gonna do it because I know I'll jump there. Okay, I'm okay there. I'm at 82. So, oof. So I'm gonna lower it a bit. So I pull so I can get right underneath. I actually usually don't pull on the second row. I let go just because there's no need. Okay. And remember, I'm leaving that part out because I'm going to lower it. So I'm going to thicken and smooth the gel. And I'm going to cross hatch. I'm going to take my piece of gauze that's folded and pull again. And I actually use the electrode too to pull down a bit.
Kara, do you want to just show how far in you can go?
Yeah, I'm doing that next. So that's how you do the lower eye typically. And if people are not sensitive, I am, but if people are not sensitive, you would just do the full. Okay, so that's how I do the outer under eye. Now I'm going to take it down. I'm a baby. I'm going to start at 60 and I'll work up a little bit. Okay. So we're going to pull and we're going to get right there.
So as long as you're on that bone, you can be really, really close because you're pulling down that tissue.
Then I let go and then I do the row right below that. Actually, I don't even really feel this. So I can't remember. I usually go to, I think, like 64 or something. I'll go up. 66. So smooth the gel. This is just what I do on myself personally. Then I go over that 6 times after I've done 6 passes here. And remember, we typically do 6 passes, 6 passes, 6 passes, and then 6 passes. We're just not doing all of that because of time-wise on the webinar. You want to get as close to that lash line as you can because we have crepey skin there, right? And for me, I have crepey skin and dark circles. So it's going to help both. Yeah, that's how close. Any questions on the eyes?
I do see one that says, how long does it normally take to see a difference in the client's lines and or lift in the brow? And they will see an immediate response, which is great. So they leave with their brow looking higher, their skin looking firmer. We also know that collagen and elastin takes quite a bit of time to actually form. So it's up to 3 months. So they're continuously seeing results from that first treatment, but right after, their skin looks awesome and tighter.
That's why it's so important to do their very first treatment. You can see how much pressure I was using because I'm a nervous Nelly in this area. Remember, the more pressure, the better. Some people feel like, oh, I don't want to press on the eyes. It's actually opposite. I would have felt it like a strong bite of heat if I didn't have pressure. So that's why I use so much.
Cynthia says edema, question mark. Yes, there's definitely some edema. The collagen's a little bit swollen.
So that's why it's so important to do one eye, if they're coming in for eyes, do one eye and then sit them up and show them the difference between the left and the right. We can already see, I only did 2 passes, which typically I'd be doing 6. So there would be a huge difference in like my brow lift and softening here and softening there. So you always want to sit them up and show them halfway, have a mirror to show them halfway the difference, because they usually get really excited with that. All right, so I'm going to just look through the chat really quick. If anybody has any questions for the eyes, this would be the time, because we're going to move on to the lips.
Okay. How much would it be for just an eye treatment then, roughly?
So in the States, it's roughly between $200 and $400 per treatment. And then that would be times by 6 or times by 8.
Okay.
So in the States, 3, 6, 9, 12, 15. In the States, it's a little under 2,000, right at 2,000 or a little over 2,000 for a full series.
Just the eye contour, yeah?
Yeah, just the eye. Yep.
Thank you.
Yeah, you're welcome. So Audrey raised her hand. I'm going to unmute you, Audrey, just to see if you maybe had not asked the question yet. Did you have a question?
Yes, I actually did, but Heather already answered it.
Okay, perfect. I'll unmute you.
I have a quick question.
Yeah.
You said you did 3 to 4 pulses. Does that mean every pass as you were going, you were pulsing 3 to 4 times?
Oh, no, sorry. So I was going 1, 2, 3, 4, up 10 joules. 1, 2, 3, 4, up 10 joules. So on and so forth. Yeah. So it's this analogy of like, if I jumped into a scalding hot bathtub, what am I going to naturally do? I'm going to naturally jump right back out, right? It's too hot. But if I get into a lukewarm bathtub and add the hot water as I'm in it, now I'm comfortable. So same thing with the skin. If I started pulsing, I was comfortable at 92 for all day, for most of the area. I can't remember. I kind of adjusted it a bit. But let's just say I was comfortable at 92 or 88, whatever it was. If I started pulsing at 88 or 92 when I first started, I would not have been comfortable. I would have went, ooh, that was hot. That was a bite. Because I didn't get my skin acclimated to the heat. So I just slowly got that tissue in the area acclimated to it, and then I was comfortable to stay there. Now, if I moved on to this brow is always so much higher. If I moved on to this brow, then I would have dropped the energy down again and slowly titrated it up for this eye, because this eye is not going to be used to the heat that this eye was feeling. So when I get done with the right side of the face, let's say you're doing lower face tightening, I get done with this side at 92, now I'm going to come back to 40, 42, start all over again, pulsing 4 or 5 times, working my way up. Same as if they come back in for their next treatment. You're always going to drop it back down to 42, get their skin slowly acclimated to it every time they come in, every area you move to. Sometimes people get confused. They think they need to drop back down when you like move here and then you move here and then you move here. You don't. You're just slowly getting the tissue here acclimated to the heat. Now your skin's ready for that higher heat for the rest of the eye. It's when you move to the next eye is when you need to go down. Hema or Hema, I'm not sure how to pronounce your name, so sorry. You raised your hand. I'm going to unmute you and see if you have a question. Did you have a question? Okay, I'll mute you again.
I think Christina has a question.
Oh, yeah, I see that. Thank you. Christina, I'm going to unmute you. Go ahead. It won't let me unmute you. Why? Unmute, unmute, unmute.
Christina, you can write it in the chat if you can't.
Hi, sorry, I didn't see I was still muted. Hi.
Hi.
Just some tips for dealing with facial, especially brow asymmetry.
Yes.
Like, do we, go with it. Like, do we go up in joules, more passes? What's the best way?
I did that for my mom. My mom had a brow lift years ago, and one side started dropping quite a bit, and the other side stayed higher. So I helped her with that. So instead of going higher in the energy, I just did less passes. Okay. So I did 6 on the area that needed to be lifted. Same with me. I have asymmetry. This brow has always been higher than this one. So like when my mom Botoxes me, she has to use more Botox on this side to keep that eyebrow a little bit lower than this. So you can do the same thing with the ST. So I did. Let's just pretend I'm my mom, right? And this eye was higher, and this eye is dropping. So I would do all 6 passes here, and then I did 3 to 4 passes here. I still did 6 passes on like her lower eye just to help her here, but when it came to the brow, I only did 3 to 4 passes. Okay. To even them out.
So you leave the energy the same. You just
I left the energy the same. The same. I just did less passes. But I mean, you could lower the energy. I still would do less passes though. I still would only do like 4.
Okay. Just to build less heat is what we're trying to do.
Yeah. Okay. I mean, if it's really dramatic, you can even just leave that eyebrow alone and just do the 1.
Okay.
I was just going to say that I've actually done that with a client.
Okay.
I've done 1 upper brow and left the other side. However, this client was in her like the early 30s and didn't have a lot of that crepey skin. It was just more that she was not symmetric. So
Yeah,
if
that's
they
what
still need some, you know, some of that heat there, then I do recommend doing some passes there.
Okay. Okay, thank you.
Yeah. Susie. I'm going to unmute you.
Hi.
Oh, hi.
Hi, how are you?
Good.
Thanks for taking my question.
Yeah,
My question would be, first question, I have two. So obviously just today your demonstration, you're doing across your passes, as you call them, a 6. So you count 1, 2, 3, 4, and then obviously you graduate the heat as you pass every 4. How many passes do you do on the same area? Are you doing, yes, you are doing the 6.
I just didn't do it time-wise. So if I were really doing it, I would have done 2 rows.
Yeah.
6 times.
Yeah.
Yeah.
So I missed the beginning. So obviously you start with the forehead and then you move to the eyes.
You don't have to. Usually on most people, I usually start lower. That's just a habit of mine that I've always started lower eye, then I go to crow's feet, then I go above the brow, then I go below the brow. It doesn't matter though, to be honest with you, it does not matter where you start. And I just know personally, I'm very sensitive right here. Not everyone is, but I'm very, very sensitive right here. So if I started here, I could keep my energy up everywhere and then just turn it down just to hit that area really quickly.
Okay.
But it doesn't matter.
What I find difficult to even make a little difference, that a difference straight away, yes, but one that doesn't last is, you know, the Piggy Line, and that, like, I would have a natural Piggy Line at a heavy forehead. So, you know, the line that literally goes across the top of your bridge of your nose, that in between your eyebrows. Yeah.
That way or this way?
No, goes crossways.
Like bunny lines?
Yeah, the bunny line.
Yeah, well, it's actually, it's not even bunny, it's that crease across the top of the nose.
Yeah,
that Botox doesn't really truly lift out fully. So how do I approach?
You would just start lower. So I started in the glabella for the brow lift. So I started here anyways.
Okay.
And because most people have the frown line.
Yeah.
So
but
I always
the
start
frown
here.
line, just a bunny.
Yeah. So if that's the case, I would start lower. I would start right on it, put the electrodes right on it, and then work up, put the electrodes right on it, then do your second row.
Okay. And then my last little question, I'm being very cheeky now. So you're moving on to cheekbone now, are you?
We're doing, Heather's doing the lips, and then I'm going to do the cheekbones.
Okay. So I shall now stop talking. Thank you so much for answering. Thank you.
You're welcome. Thank you for asking questions.
Well, you can just talk all the time because I just love your accent.
Right. When I was over there, Heather, I was in heaven.
Isn't it so funny? And we don't hear ourselves at all with an accent.
I know.
So
when you hear Heather and I speak, you hear an accent.
Yes, but it's gorgeous. It's light. It's singy. It's very singy voices. No, it's really lovely. It's very feminine. Yeah. Okay.
I do hear that though, Heather, when I go overseas, is they like the American accent because it's easy to understand, because how we pronunciate everything. It's very clear. That's what I always hear. It's very clear. So
very clear.
They like it because when we're teaching, they can understand, you know?
Yeah.
So that's a positive, Heather.
That's a definite positive.
You know, we really hear that a Boston accent is beautiful very often. So
I know, or an American accent in general, ever.
Well, you just haven't lived in Ireland because we compliment you all the time, so it's okay.
Yeah, they do. All right, so now Heather is going to do her lips. So I'll be talking a lot. So Heather, if you want to get prepped up, I'm going to turn off my system so it's not so loud.
I'm going to show them how to get prepped, and they can't see me.
What do you mean?
We have to change the spotlight, right?
Oh, right.
So I'm going to show them how to prep.
Okay, let me spotlight you. Hold on.
But you're going to have to probably start talking after I stick this in my mouth.
For sure, for sure. I would not make you do that. Oh, okay.
So we all have these gauze.
Wait, I just want to make sure everyone can see you. I've spotlighted Heather. Will somebody write in if she is spotlighted? Yes. Okay. Can you guys still see me in a small box? Yes. Okay, we're good. So you're big, Heather. I'm small.
Okay. All right. So these non-woven gauze that we all have, that we all use, this is going to be inserted into the mouth over the teeth. And the reason why we do that, there's a few reasons. One, if you were to slip, you're using gel, it's kind of a hard area. If you were to slip, the teeth are protected. The other reason that we do this, that we put this into the mouth, into underneath the lips, is that it makes it so that the gel doesn't actually go inside the mouth. So you'll see when I'm done, there may be lots and lots of gel here, but I pull it out and there's no more gel in the actual mouth. So like I said, I'm probably not going to be able to talk too much after this, but the way that I found that it's easiest to fold is in half this way, and then kind of just pull the corners in like this, and then I insert it. And also, I never put this in someone's mouth. I actually hand it to them and have them put it in their mouth, because it is kind of awkward to stick your fingers inside somebody's mouth. And I'll put it in, I'll put one actually in the first time I do someone's lips. I'll actually put one in my own mouth just to show them how it's supposed to look. So that's what I'm going to do now.
And I'm going to, while she's doing that, I'm going to show you guys something too. So another reason why we want to put the gauze in is it helps to dry the wet dry line. And when you dry that wet dry line, you can also pull, dry, and pull the lip out. Of course, you have gloves on when you're in somebody's mouth. So remember, don't order woven gauze. You want non-woven. Woven is going to be a huge mess. The gel is just going to slip right through it and enter their mouth. Plus, it's not going to really protect their teeth. So I actually, with a 4x4, I just fold it in half. That's what I do. Unless it's too big for their mouth. So I'll slowly, I'm going to get really close, and I'm going to slowly show you how she just inserted that. You're going to have it between your teeth and your cheeks. Like that. So I also use my tongue, and I tell them to do this trick. I use my tongue to push it forward. So once I'm here, and then I'm here, I want to curve like that. But push your tongue and your tongue to kind of help maneuver it. And then at the end, if they don't have it quite right, because usually most people don't have it quite right the first time, you have gloves on, then just go in and tuck. Then use your gloves and pull like Heather's doing. Pull, because you want as much of the lip out as possible, because we want to be right on the lip. So you're just going to pull and pull until you get the lips out really nicely. Okay, so she's got her gel, her tongue depressor. And she's going to gel on the lips and around the mouth. So we're doing 4 rows. We're doing a row right on the lip, right below the lip, right on the lip, and right above the lip. The reason why we go around the mouth is because any type of fine lines and wrinkles they may have around the mouth, to help strengthen their vermilion border, to give a little bit of that lip flip. And we naturally have a lip flip when we're young and youthful. We start to lose that ski slope as we age. So it just helps that lip flip to increase that. Additionally, as we age, we get a downward droop to the corners of the mouth. And when we take it above the lip and we come all the way out to here, pretty much out to the nasolabial fold, we lift the corners of the mouth. Okay, let me see in the chat here what questions we have while she's putting that on. I only see Heather. Nice, super white teeth. Yeah, it gives you instant white teeth. So when I was showing you guys up close how to put the gauze in, could you guys not see me? You could see me? Okay. They have to move the list of guests. I see both in the grid. I didn't see you. Okay. While you're doing that, Heather, I'm gonna cancel your spotlight really quick, and I'm gonna spotlight myself just to show that while you're getting set up. Okay. Hi guys, so now I should be spotlighted. So while Heather's getting set up really quick, I'm gonna show you how to insert that gauze really up close and slowly. So a 4x4, fold it in half, or you can do it the way Heather does it. And I'm gonna show you this is how it's gonna insert. Right there. And here. Down here. And here. And in here. Pull. Pull. Oh, ho, 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 ho. That's how you do it. Okay, I'm going to take my spotlight off. I'm going to spotlight you, Heather. Let me find you really quick. Spotlight video. Perfect. Okay, you're spotlighted. All right, so she's going to start at about 40 joules, and we typically start right under the lip, that skin right underneath. And she's going to do it just like the eyes, where we overlap by 10%. We pulse 4 to 5 times. Then we go up about 10 joules. She's pulsing about 4 to 5 times. She's going to titrate up 10 joules. And remember, on the right side of the screen, you can just hit the plus and it will go ahead and jump 10 for you. So now she's going right on the bottom lip. And again, she's going to pulse 4 to 5 times. And take your time on the bottom lip. Really go slowly, because you want to make sure that you get both of those electrodes right on the lip. And some people don't have lips as large as Heather's, so it may take you a little bit of time. So she pulsed 4 to 5 more times, and she went up 10 more joules. Yes, we are in mode 3. And now she's going up 10 more. So now she's going above the top lip. She's staying right above the tissue. And remember, that's going to help lift the corners of the mouth, because she's going all the way out to the nasolabial fold. Did someone have a question? Christina, I think that's you. I'm going to mute you unless you have a question. Oh, you muted yourself. Okay, so she went out all the way out to the nasolabial fold to really lift the corners. So she went here, 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 and that lifts the corners there. Now the top lip is usually never as big as the bottom lip. So if you need to, you can straddle the vermilion border, meaning you can have a little bit of the electrode actually on the pink of the lip and a little bit of the electrode on the actual skin. So you're just straddling that vermilion border just in case you can't fully get on the full lip. So sometimes, you know, when you're really taking the time with your gloves and drying the lips off and really pulling them out, you can sometimes fully get on the top lip if you're slowly taking your time, but sometimes you can't, and it's okay. You can just straddle the vermilion border, nothing wrong with that. She's wiping the electrodes. Remember, after every pass, we wipe the electrodes because we don't want too much gel to accumulate on the tip and it insulate and overheat. Oh, you forgot to crosshatch. So now we're crosshatching. So she's turning the electrodes in the opposite direction. And now you'll see sometimes it's even easier to get on the lip when you are going horizontally. So now, yep, you can really see that well, that she has, maybe the electrodes on her skin, that's okay. You're still getting a lot of that energy into the pink of the lip. And I think she actually does have the full 2 electrodes on the pink of her lip, which is great. And as you go, they start to get bigger and bigger and bigger, that if it was hard to make full contact with the skin, then the next, you know, row, or I'm sorry, the next pass or the 3rd pass or the 4th pass, as they start to swell, then it's easy to actually have contact with the tissue. Okay, let me see here in the chat. If the area is small, wait, let me see. I want to make sure I got the latest question. Keep hitting arrow until you show up. There's an arrow beside all the names. Scroll through to Kara or Heather. Oh, thank you, Jade. That's too bad that it doesn't just show, you know, easily. If the area is small from upper lip to base of nose, that's called the philtrum. So she's talking about the philtrum here. What is your recommendation to get result? I have never had somebody with a philtrum so short that I can't get the electrodes in. And I've treated a lot of people with short philtrums, and you just pretty much get the nose out of the way. You can really go in there. I don't know if you guys can see me or not. If you guys can see me, you really just don't worry about the nose. Just push it out of the way. You can really get in there. I have a very, very long philtrum, which is the thing that I hate about my face the most. I wish I had a small one, but let's pretend like I did, and it's like this. You just get it in there. Just get it in there. And move that nose. What mode? Yes, mode 3. If someone has a larger mole like Cindy Crawford, do you go around it? Yes, Hillary, very good. Yes, you just go around it, skip over it. I see you. Oh, perfect. Okay. I have found that sometimes the gauze got very wet. Does that affect the result? Should I change to the new one? No, there's no need to change the gauze. It will get very wet because you have gel. So as you're going, a lot of the gel can slip into that gauze area. So just take your tongue depressor and scoop it out. See, scoop that out, the gel out of the middle. See? She just scooped it out and placed it on her lips. And it's gonna get wet. I mean, it's in the mouth. So that doesn't matter. Remember, the gauze isn't making any difference on a result. The gauze is protecting the teeth. It is, you know, keeping the gel out of the mouth. And in the beginning, it helps to pull that lip out. But as you go, as you move forward, don't worry about it getting wet because it is in the mouth. I think this can be the last pass, Heather. That's 3, right? Yeah. Thanks. Yeah, you're welcome. Any other questions while we're doing the lips? This would be a good time to ask.
As the lip is swelling, then are you doing more rows inside the vermilion?
No, there's really never any need to. It really, if someone has a really big lip, it's not going to be so big to where it's going to need 2 rows. Because there's no need to go inside here, the wet line. Or, I mean, here. I don't know if you can see me well, but what matters is that we're here on the pink of the lip, not inside the mouth. So no one's going to have, you know, such a big bottom or top lip to where you're going to need 2 rows.
And Heather, could you show me the point of the ST? We haven't been able to get to our machine yet. Could you face the electrode towards the camera and then show me where your overlap is about? So you're overlapping 1 prong just about.
It's just right next to one another.
Thank you.
Yeah.
Hi.
Hi.
Hi, Kara. She's putting it on the lip and the skin, right? The first pass would be around the lip and the skin, half that?
So the first pass, she may have been over, so the first row right below the pink of the lip.
Okay. Okay.
And then second row is right on the pink of the lip.
Oh, okay. So you're never like half. You're always right under and then right on top.
Yeah, usually you're kind of straddling the vermilion border sometimes.
Okay.
And then the top row is right above the pink. Yep. And then yep, and then the next row is going to be right on the pink, which, see, she's kind of on the vermilion border a little bit. And for most everyone, you are, because the top lip is somewhat smaller on most people, you know?
Yeah.
So, you know, you want to get the electrode as much as you can on the pink of the lip, but if a little bit is on the vermilion border, that's totally fine.
Okay. And how many treatments before you see a result, and about how long does it last?
You'll see it after the first one, usually, always.
Oh, sorry, go ahead.
Yeah, usually after the first one, you see it, and they get excited. Usually they're wanting to book their treatments on like a Friday or Saturday because it plumps immediately. Now that immediate plump can last a couple weeks. However, that's not going to last forever. When they do their full series, that's when they're getting year and a half lasting.
Oh.
Mm-hmm.
Okay, and it should be a series of 6 every 2 weeks?
Yeah, it could be 4 treatments if someone's much younger and wants a minimal plump. It could be up to 8 treatments if someone has really deep lines around the mouth and needing a bit extra. It's every 2 weeks if they're younger than 60, and then it's best to space it out every 3 to 4 weeks if they're older than 60. And then it's best to do 1 maintenance session every 3 to 4 months.
And this could last about a year, plump.
It could last longer too.
Okay.
Just because we're working with our own natural collagen elastin, so it can, can definitely be long lasting.
Thank you. Thank you, Heather.
If you notice, I take this out. As long as you clean up before you take this out, there's no gel anywhere.
May I be rude and jump in, just ask that little question? I saw a question flash up and I was thinking the same thing. You know, when you're doing this treatment, you're still on mode 3 because you've done mode 3 around the eyes.
Mm-hmm.
Is that why you move from the eyes to the lips? Because it's directly both going to be mode 3?
No, it's mode 3 just because you want to stay a bit more superficial on the lip. You don't want to get into the fat area of the lip, because we want to not disrupt any type of fat in the lip. We want to just work on collagen within the lip. However, you could go a bit deeper around the mouth. So let's say they have pretty deep lines around the mouth, then you can, on the actual skin, you can do mode 1 or mode 2, just depending on their age. But typically it's just easy just to stay on mode 3 for the full treatment, and we've seen results with even lines in mode 3. But you just want to be careful not going too deep on the actual lip part itself.
Okay, thank you.
Yeah.
My lips are plump.
Yeah. So that's, you know, you can see it after 1, which is amazing. Heather, where did you end up with your jewels? Where were you at your jewels?
86.
Oh, nice.
And honestly, I would say I was more like a 2, not even a 3.
Yeah, that's how it was for my eyes.
Should I do all the passes that we normally do, I might have been at a 3 at that last pass, but super comfortable.
Yeah. I was the same for my eyes. I could have gone a bit higher, but and if you feel like, wow, this is really high energy, I can't get my clients that high, just make sure you're questioning how much gel are you using, and the biggest thing, how much pressure are you using? The more pressure you have, the more comfortable you're going to be. Remember how I said Heather's the queen of pressure? That's why she was up to 86.
I recommend doing a treatment on yourself though, and just feeling that pressure helps so much. So if you're nervous about pressure, if you feel like you're putting a lot of pressure and it's hurting someone, I guarantee do it on yourself. You will immediately realize that that is helping to make this a much more comfortable treatment. Actually, it's the complete opposite.
So they said, not really. So she was asking, does the gel get inside the VST if you use a lot of pressure? I see what you're saying into the vents here, but you're not using so much gel and pressure typically to where you're getting inside those. See here, if I had a lot of gel, I'm still so far from this. Here, where it's squishy, that's where you can sometimes get into that. But even if the gel comes into the fan here, it's okay. Just don't try to get the gel out right when you're done with the treatment. Let the gel dry. When the gel dries, just take a little toothpick and just kind of pop it out a bit, and then it will just pull kind of like a piece of tape off there. Just don't try to get in there and clean it, because then you can push the gel inside the fan. But I've had this handpiece at my house for years, and I've used it a ton, and I use a lot of pressure, and I still haven't gotten any gel inside there. Oh, I don't see you, Kara. I'm just talking. Let me cancel spotlight on Heather. Okay, can you guys see me now? So what I was showing is that even if I had a lot of gel here and I'm using a lot of pressure, I'm still so far from the fans. When you get into this area, squishier areas, that's where you can get into that case of the gel coming up a little further, but you're still pretty far from those fans. And that's why you're always like, you're wiping the electrodes after you're done with each pass to make sure it doesn't accumulate too much to push up to the fans. But just in case you do end up getting into a scenario where the gel kind of gets right here, again, just don't try to get it off or like clean it right away, because that's when you can end up pushing the gel inside there. Instead, I mean, you can still clean it with alcohol, but then give it a bit of time and let it dry. And then you can just take a toothpick and just kind of pop it out of the fans and pull it almost like a piece of tape, because the gel has then dried. So then it's really nice and easy to get off. That's just in the rare case that it does get up that high.
Kara, do you want me to set up the contouring while you do the cheekbone?
Yeah, I love this treatment, very natural and fresh. Yes, yay!
Yeah.
So now we're going to show you something really exciting, which is cheekbone contouring. I was just looking at the time. It's been an hour and a half. So usually I think this webinar will probably be 3 hours is what I'm guessing. So we're right there in the middle, and I always like to give bathroom breaks for anybody that needs it. So let's do this. It's 11:19, or I should say 19 after the hour. Let's come back 30 minutes after the hour, and we're going to do cheekbone contouring. We're going to do body contouring. And then if we can figure it out, we're going to do IPL hair removal. I'm not promising, but I'm going to try to figure it out. So yeah, let's do that, Heather. Let's just take a 10-minute break.
Okay, great.
And we'll see you guys back 30 minutes after the hour. sorry, by the way, if you guys haven't walked off yet, you guys don't have to jump off. You can just keep the screens on. You're all muted anyway, so it's fine. Just keep it going, keep it rolling.
Is it quick?
Okay. And we are back. Let me just make sure I've spotlighted myself here. Ooh, Heather, you're all shiny now.
I know, because I needed the bed, so I have to have a different back.
I love it. It's like
Distotech.
I'm here. All right, so let me cancel yours. Wait, who's spotlighted? Let me see. I am. Okay. I'm spotlighted. All right, here we go. So we are going to show you guys a trick for cheekbone contouring. Now, if someone comes in with nasolabial issues, I recommend adding this trick on as well, because if you guys are injectors, you know, like filler injectors or Botox, whatever it may be, but filler injectors, you know that if you just fill here for nasolabial issues, it ends up not looking great. It ends up looking unnatural. And the reason being is I have a bit of nasolabial issues right now. So you can see that if I pull, that fixes it. So a lot of times with age, we start to lose the elasticity in collagen, right? So this starts to droop down. It starts to push here on the nasolabial folds. So yes, you can treat here doing one row right on the nasal. If you're going to do the nasolabial folds, I like to do 3 rows. 1 row here, 1 row right on it, and 1 row on the other side of it. And then do this cheekbone contouring lift pretty much, and then it lifts the nasolabial folds. So that's really what we're concentrating on, is that lift. Additionally, when we're younger, our faces are a lot more round. So if they hate the roundness of their face, you can do this trick to contour the cheekbone, and it just pops out the balls of the cheek, and then it really defines the cheekbone. So that's what we're going to show you guys here today. For me, because I am in the younger, thicker range, I'm 39, so up until about 45, I have thick skin. That's so scary. That's only six years away. So I'm gonna do, actually I'll have you guys, we'll quiz. What mode or modes do you think we'll use on me for the lower face? We're staying right below the cheekbone, so it's considered in the lower face area. 2, okay. Anybody else wanna take a guess?
1 and 2.
Very good. And why modes 1 and 2?
Because of your age.
Very good, because modes 1 and 2 are the deepest depth of penetration, right?
Yeah.
So for me, my reticular and papillary collagen are still considered deeper. All right. Let me get situated here. Let me grab my mirror. Okay, so I just set it to mode 1 at 42 joules. So the first row, I'm just gonna, and pressure is gonna help you with this, I'm just gonna stay right below the bone. And I'm starting right at the corner of the nose, and I'm staying below the ball of the cheek. Think of it like a Nike check mark, or just a check mark in general. Kind of a swoosh. So I worked down to pop out the ball of the cheek, staying right below the bone. I got to titrate up my energy. I'm talking too much that I forgot. Now I'm at 52. And now I'm right below the cheekbone. I can feel it. If I push up, I can feel that bone there.
I was just asking if you were already in there. Oh, okay. No, because I have all this salad, but I don't have anything to like eat it with. For if you guys.
Let me mute that person.
That's why I wanted to.
There we go. Okay, so that was my first row. Now I'm at 72 joules, so I'm just slowly titrating up. So now what we're going to do, so remember, I would be, if I were the patient, I would be laying down and you would be right behind me, standing up or sitting down behind me. So the handpiece would be like this, right? So now we are going to slide and scoop. So watch. So we're just kind of angling it in and up below that bone. So you're just a tad bit higher than where I just was, and we're angling it under that bone. Slide and scoop under it. Slide and scoop under it. Here, you can't really scoop because everything kind of flattens out a bit. So that's okay, just angle it kind of in and under the bone. But you can see the redness already. And you can see the shape of it. So I'm slicing the cheekbone, but I'm popping out the balls of the cheek. So now I'm gonna take my tongue depressor. I'm gonna gather this gel that fell down and reapply it, smooth my gel. Remember, never skip this step because you're gonna go in for your next pass and they're gonna jump and say, ah, that hurts, because there isn't any thick gel there.
So was that considered one pass?
That was considered one pass,
Yes.
just two rows. So now I'm gonna get a piece of gauze here.
The gel doesn't move around that much. We're just sitting up, so it, you know, gravity brings it down, so it won't drip down the face quite as much for you.
Remember to wipe the electrodes. And we were talking about pressure and gel and it getting into the fans. I was in the squishiest area of my face where I could potentially squish down and get it into the fans, and I didn't. Reason being is I was keeping this nice and flat at a 90-degree angle. And it really didn't get anywhere close to the fan. So you should be fine. There, okay. So now I'm going to crosshatch. So remember, start right at the corner of the nose. Ooh, that's bitey.
Timeless Glow says we can already see the difference. You can.
So exciting. So right under the bone, I can feel it. I'm just keeping my electrodes nice and flat.
Cynthia wants to know what your joules are at.
I'm at 82. I shouldn't say only. I barely feel it here. I could definitely go up. I just don't know if I'm gonna have time today to do the other side, and I just didn't want a huge change left side and my right side, but I could probably go up. Just right there was bitey. I don't think I had a lot of gel there though.
Probably just more nerve endings closer to the nose too.
Mm-hmm. Okay, so now I'm going to slide and scoop. Now it's okay. Slide and scoop.
And that slide is just to ensure that you're right underneath that cheekbone and that you're kind of scooping up towards it.
Yeah, kind of scooping up almost under the bone. And don't do a slide from like up here. Sometimes people and some people slide and miss your target. So you're down here. It's just a subtle subtle slide to where as soon as you fall off the bone, you scoop. As soon as I fall off the bone, I scoop. So pressure is going to help you with that. So I can feel right where I need to pulse here. Let me get a little closer. Since I'm not using my mirror, I'm just using the camera here. It's almost like a pocket that I fall into. Remember, I don't have much of a scoop here because it's a bit flatter. So I'm going to do one more pass, show it one more time. Heather, are there any questions or just comments coming in?
Let's see, did you go above your ST line or under? Nasolabial line, is that what you're trying to say? Did you go above your first? Sorry. Did you go above your first line or under?
It's kind of above it. Slightly above it. Let me show, I'm going to show you guys really close up on this last pass. So I just did 2 passes in mode 1. This is when I would then switch it to 2 passes, or I'm sorry, 4 passes in mode 2, but I'm not going to do that many. Just because that would be, again, boring for you guys. I'm going to put my mirror down because I'm going to try to not use it, and I'm going to try to get really close into the camera and show you guys that way. All right, so first row, just flat.
That 10% overlap is super important. It's exactly how she's doing it.
And don't leave out like by the ear because it gets crepey there as well. So that's always helpful. I just have like the craziest sideburns, so I can't get all that close. But go as far as you can. Okay, so now, second row, the scooping, you would typically have it like this. So it's way easier to scoop this way. I'll try it. You can see I'm one row, almost one row above where I just was. As soon as I slide off that bone, I scoop under. In the first row, I was here. Second row, I'm here. Any questions on that? So you would do that 6 passes, and then if they have heavy nasolabial folds or they have a deep nasolabial line, then you could do those 3 rows here. 1, 2, 3, 6 passes. And if you do that and that, it is a dramatic lift to the full lower face. That's if they don't need the full lower face, you know, they just need a lift of this heavy area.
I find that this is a great treatment for someone in their late 20s, early 30s, for sure.
Yeah, because
they're not jowling yet, but they just need that little lift.
Exactly. I always had the way my face was, or is, but it was more prominent when I was younger, in my 20s. My face, how it's designed, is I have this strong fat here. So I always had very deep tear troughs and very deep nasolabial folds when I was young. You know, I look back at my elementary school pictures and I had that. So it always bothered me. So then when I was in my 20s, I got my tear trough area filled, which has lasted a long time. I did it a few times. And then they used to fill the nasolabial fold area, but now they don't do that anymore. Instead, they put the filler here because they know it will lift this and it will no longer make this heavy. Because if you overfill this area, then it starts to look odd, you know? So for me, instead of getting filler, I could have done the ST here and just need minimal fillers if I needed it, and then do what you were just saying here and a bit here, and it would have lifted that area. It would have really changed that deep set areas that I had here and here. But since I've gotten older, it's starting to look better because I'm losing fat. That's a positive. Aging. Usually losing fat is a negative, but for me, it's been positive. Okay, so any questions on that little trick there that we showed you?
Cynthia says 6 passes each row, and each area you're going to do 6 passes on.
Yeah, so it would be 2 rows, then 6 times. So on and so forth. Some people accidentally think that cross hatching it, so going vertically then horizontally, is 1 pass, and it's not. A pass is considered just passing over the tissue. So we're doing 2 rows and then we're passing over that 6 times with those 2 rows. Does anybody want to unmute? Heather, when I did the IPL webinar, there were so many people unmuting. It was fun.
Can you repeat what 1 pass is again? I'm sorry.
Sure.
What's one? Yeah, what's 1 pass?
Yeah. So a pass is considered just passing over the tissue. So what I just showed you was 2 rows, but that was 1 pass. So doing those 2 rows, passed over the tissue 1 time. Then I turn the electrodes in the direction, and then I pass over the tissue again.
Oh, okay. I got it. Yes. Thank you.
Yeah, you're welcome. Any other questions? So Heather, I think I'm going to try to rearrange my setup and get on the floor.
Okay.
For IPL hair removal. So do you think, I'll just turn off my camera. I'll be able to hear you though. So if you like need my help at all,
yeah, sure.
I'll be here. But do you think you're okay without me just for a bit?
Yeah, I think I'm good. I mean, I'll call you if I need you.
Okay, so let me cancel my spotlight. You can just say Kara because I'll still be here. I'll still hear you. And then let me spotlight yours. I know exactly where you're at in your office. I'm going to go through the chat really quick, make sure we didn't forget anything while you're getting your handpiece. Could you alternate this in the V form on the face every week? Okay, so could you alternate this in the V form on the face every week? No. So first of all, the V form, you can do every week, the V form, because you can do it for contouring. But if you're doing it for skin tightening, you're going to want to space it out. So the only reason you're going to alternate this with the V form is really if you're doing the relift protocol. And the relift protocol is going to be every week, yes. And you're going from contouring and then skin tightening. But if somebody is just needing like, let's say someone has some fat issues and loose skin, then it's better to just do the refit protocol with the V-form every couple of weeks, or space it out a little bit longer if they're older. If they're younger and they don't have really any fat issues, they just really need to like contour the area or kind of lift the nasolabial fold a bit, then you would just stick with the ST every 2 weeks. If they're older, every 3 to 4 weeks. If you have a specific type of patient that you're thinking of right now, Bree, if you want to unmute yourself and let us know, then we can help you with that.
Yeah, what about for jowls?
So jowls, it's best just to stick with refit. So refit is going to be the V-form and using mode 4 the whole time. Because if you just use the ST, it may lift the tissue, but they still have that fat accumulation on the lower face, which is an issue. So I would just stick with the refit protocol every couple weeks with the V-form.
Okay, thank you.
Yeah, you're welcome. Heather, that's perfect. Okay, so can everybody, oops, I just spotlighted myself, shoot. Hold on, Heather, let me spotlight you again. I just accidentally clicked on me. Heather, can you hear us, Heather?
Yeah.
Okay. Speak again. I don't know if we can hear you.
Hello.
I don't know why we can barely hear you. You might need to like yell, or I may need to talk. Are you speaking, Heather?
Yes.
Oh, shoot. Okay, so I'll talk for you. Because we can't hear you. And then I'll set up, you know, towards the end.
You can't hear me at all?
It's weird because you seem so close to the video. All right, so I'll talk for you. You're using the medium, I think, yeah? Medium, okay. So she's using the medium on her abdomen. Now, just keep in mind, you guys, when you're doing contouring for the abdomen, you're always working in towards the belly button because we want to work in the lymphatic direction. And remember the last hands-on one that we did, I spoke about feel where you can't see, look where you can. So you're really going to be using your hands down onto the like the tip of the handpiece. Really, always think of it this way. Always, I have tried to do V-form on myself when I'm sitting up. It seems easier. We wanted to show you properly laying down. But feel where you can't see. So you have to get your hands involved. You really have to get your hands down onto the handpiece, down onto the skin to make sure that you're not losing contact with that handpiece. So she's feeling on the back end of that handpiece, making sure that she doesn't, you know, slip off the tissue. So if she was treating somebody, she would, no, she's not using the foot pedal, she's using the handpiece. So what she's doing is she's holding the trigger down and she's pulsing a few times in one area. So you can pulse 4 times in one area. If someone's really hard to treat, then you can pulse 5 to 6 times in one area. But you can see her hand is like down onto the skin. She's sliding her hand along the skin, making sure she can feel, because that's the biggest thing with the V-form, is people slipping off and creating arcs or blisters. And the reason for that is just because they didn't have their extra hand involved in the tip on the skin and really feeling where you can't see. It's a huge positive that the tip is very large right? So we can treat a large area. We can also hold heat really well on like the full abdomen. But the biggest thing is always knowing where all those electrodes are at all times. So as she's feeling, as she's going, she's constantly feeling around the tip, making sure she doesn't slide off, especially when you're working in areas like the flanks. Like she just went over to her flank area. If she were standing up and doing the treatment, she may not be able to see that other side of the tip. And where is it? Is it hanging off the flank? Can you pulse? That can be an issue. So she's constantly cupping it. She's constantly, her fingers and hands are actually sliding on the patient's skin. That's why I usually love gloves, because glycerin is so sticky. So you're like down in there and you know, you got your gloves on and you're sliding on the skin. She's doing it herself, so it doesn't matter. And she's pulsing, I think 4 times, yeah. She's pulsing 4 times in one area until she preheats. And here's, like I was talking about on the didactic, it's a good way of remembering it is radio frequency 4, vacuum 4, mode 4. We always use mode 4 for preheating, and 4 stacked pulses. Most everyone is comfortable with that. If she was having a hard time preheating herself, then she would try 5 stacked pulses. Sometimes they're fine with that. If they're really hard to preheat, maybe she'll try 6 stacked pulses. We usually don't go above that though, because that's when it starts to get really hot and people jump. But usually 4 stacked pulses is plenty to really preheat. But she's starting from the side of the flank, working to the belly button. Then she's going to the other flank and working towards the belly button. She's really feeling around the tip. And those are the main things to really consider. Other than that, the V-form is very simple. As long as you're constantly feeling, as long as you're doing stack pulses properly, you know, your settings are set properly, you know, make sure you study the protocol, so on and so forth. Okay, so I'm gonna look at the chat here. Oh, no other questions. Does anybody want to unmute themselves and ask any questions for the V-form?
Do you ever do just one side and then the other, or do you mostly always do them both together?
Usually both together, and that's the positive of the V-form, is because it's so large, you can treat the full abdomen in one. So really the reason why our older system that we had, it was called the Reaction, and the handpiece was fairly small, and it was just 2 electrodes. So then when we created the platform system, when we created the V-form, we wanted to create a handpiece that was large with multiple electrodes so we could build heat quickly, easily, and hold heat really well. So we could treat a full abdomen, or we could treat the flanks and the abdomen all in one. So if she were to want to treat her full flanks, maybe a little bit lower on her abdomen, if we weren't on video right now, she could use the large and hold heat all the way from her flank and down lower in her abdomen, and maybe even up in the middle of her rib cage area. She could probably even do it with the medium size. If she had a larger patient, then she could use the large and hold heat. So yeah, we recommend doing the full abdomen just because it's your time, right? It's their time, but it's your time, and your time is money. So if it can hold heat for the full abdomen, then, you know, do it in 20 minutes instead of it taking you 40 minutes, you know, which is getting close to an hour. It is safe to go over belly button. So you can go over the belly button. You just need to make sure that she's right over it. So you could just see what she was doing. She was right over the belly button, not teetering. She's not having, you know, one electrode kind of teetering on the belly button. And that's when you can have a space, right? A gap. So you'll just put the handpiece right over the belly button and pulse. And then when you get onto like areas of like bony areas, like her rib cage or her hip bones, when she hits those areas, she just makes sure to slide off, and you can see it. She's right under that rib cage. She's not on the rib cage teetering on it. Same with the hip bones. She's not right on it. If she rolls on it, she'll slide off and into the abdominal area. So once she's preheated, let's say she was preheated and she's doing contouring, so she would move to mode 1, then she would only have to pulse 1 or 2 times to hold heat. She typically wouldn't have to pulse 4 times in one area. If she was losing heat in a specific area, then she would just release an additional pulse to get it back up to temperature. So really, you're just watching your temperature gauge on the handpiece, and if it's 40 in an area, then just release 1 pulse, or 42 in an area, just release 1 pulse. If it's 39 in an area, then you can release 2 or 3 pulses to get it back up to a higher temperature where it needs to be. So you're just really, you know, gauging the temperature and watching it. In contouring, she's always going to work lymphatically. Once she gets to the last 2 modes, modes 2 and 3, it doesn't really matter. You don't have to work lymphatically. You can still do so, you know, that's fine. But those last 2 phases is going to be skin tightening, modes 2 and 3, and you can either glide on the skin or you could just do a single pulse. If you're first starting out with the V-form, don't try to glide right away, because when you're gliding, that's when you can glide right off the skin. So get really comfortable with just doing stacked pulses or 1 single pulse and then slowly moving it. Once you're comfortable with that, once you're comfortable really getting your hands down onto the tissue and feeling around the tip, then practice that gliding. And you guys can turn off the radio frequency and practice it without the RF until you feel really comfortable with it. But you can see, you know, she's working lymphatically because she's still in mode 1. Any other questions?
Cara?
Yes.
So I presume you do like your measurements for a client, obviously, at each treatment or before, mid?
We actually are not big measurement fans.
Don't do, yeah.
So you can, for sure you can.
Or the best before and after pictures then, yeah?
Yeah, that's a lot better before and after photos, because you can contour the area and make it look really beautiful in before and after photos. But if they're kind of thinking of it more of like a weight loss type treatment and they only lose a couple centimeters, they may mentally be disappointed in the treatment when their before and after photos may look phenomenal. So we're just not huge fans of the measurements because of that. I mean, it's something you can do for sure, but.
Cool. And post-pregnancy then, what's your guidelines?
In terms of like when to treat or how to treat?
When to treat.
It's best to treat when they're done breastfeeding. And the reason being is just overall hormone fluctuations. There's so many hormone fluctuations post-pregnancy while they're breastfeeding. Just to be able to get great results, we recommend after they're done breastfeeding. And then they may be kind of in a scenario where they need both contouring and refit, because maybe they have a little bit of excess fat on their belly that is hard to get rid of because of pregnancy. Maybe they have a little loose skin because of the abdomen being stretched out. So if they have both issues, it's best to start with contouring, contour the area down, and then switch to refit for tightening. But yeah, it is best just to wait after breastfeeding.
Thank you.
Yeah, you're welcome. Asked this earlier, but had to leave and did not see the reply. Is this recorded, and will there be a link to see the full presentation? Yes, it is recorded, and you can go to the Viewer Online Academy and view it there. Before and after pictures are the best. Yeah, exactly. All right, any other questions? Is the series of treatments, if the series of treatment has been interrupted by the pandemic, how should the series be restarted? If it's contouring, you're really going to need to start from the beginning to get the best result. If it's skin tightening, you don't necessarily need to start at the very beginning. You just kind of have to assess, assess really where they're at. But most likely the cellulite and contouring will need to be started from the beginning. We spoke about this before on like, do you charge them? And I would say you don't want to give away everything for free, by no means. If you're doing something like IPL hair removal or pigmentation removal or overall skin rejuvenation, that's not going to be really disrupted. You've removed a lot of the pigment. That's, you've done your job. It's okay that you've had to, stop for a couple months and then come back into it. So, that shouldn't be an issue. Now, if it's contouring or cellulite and they did 2 treatments, now they have to start over. I don't know, Heather, what would you say? Like, if you have clients that are in the, had done 2 contouring and cellulite treatments and the pandemic happened and now they have to come back, would you just do those 2 for free if they're starting over? Oh, shoot, we can't hear you. We'll see. When Heather cleans herself up and sits up, we'll see what she recommends, because she has a med spa there, so she's in the same boat. I personally, if they had done 2 or 3 treatments, I wouldn't charge them, because it's not their issue. It's not your fault. It's not their fault. They've already paid for a full series. I would just do those 2 for free personally, but let's see what Heather says. I would honor and start over. Yeah, I would too. I would honor and start over. I would continue as normal, then reassess at end of series. At that point, comp 1 to 2 needed. Yeah, exactly. I would do the same thing. Yeah, I would just honor it. Yeah, now we can hear you.
Okay, that was so weird that you couldn't hear me. I was like probably.
I was thinking the exact same thing. It wasn't like you were far from the computer by no means.
No.
Wait, let me cancel my spotlight. Let me spotlight you. Okay.
So, I would agree. I would say adding a few to their treatment package would be a very nice thing for you to do. And obviously, if they're going to see great results, they're going to do more things with you. So it's beneficial for you, so that they see results from all of this. So I would say adding a few treatments to their package is what I'm going to do, is what we're going to do. And it's tough when they have had like 6 of their 8 treatments or something like that, because you're not going to comp 6 treatments, obviously. So adding a few to a package, they've already gotten the majority of the results from their treatment at that point. So I would say adding 1 or 2 is just good practice. But make your own decisions for your own practice, absolutely.
Because we're in a time where we obviously want to keep our clients, right? We want to keep them happy, and it's just kind of unfortunate that, of course, this happened to you guys in your med spas or your doctor's offices, but it's also not their fault either. So, and you don't have to give everything away. Some of your treatments were pigment. Some of your treatments were vascular. That's done. You don't. It's not going to mess up their results by no means. And not all of your clients are cellulite and contouring, but the ones that are, just, you just honor that.
Right.
Okay, so Heather, what I'm going to do is I'm going to turn off my camera because I have to completely redo my whole setup. So I'm going to turn off my camera and I'm going to mute myself, and it'll take me like 10 minutes. So if you just want to keep talking, like answering questions or talking about protocols in general.
Yeah, sure. Why don't, I'm going to actually, this is super uncomfortable to sit up on this bed. So I'm going to move over again, back over there. So if you want to just take like a few minute break.
Perfect. 5 minutes.
Yeah, 5 is perfect. And then I'll do that. I'll answer all questions.
Awesome. Okay, so 5 minutes, you guys. She's going to reassess herself. I'm going to start redoing myself and my setup, and then we'll do hair removal on my legs. So I'm just going to mute myself, turn off my camera, and then she'll be with you guys in 5 minutes. And I'll probably be with you guys in 10. That scared me. I'm back. Sorry, guys. It was weird.
Where are we?
So I stopped my camera and it almost like looked like it was going to kick me out of the meeting, so I got scared. Let me try this again. Okay, I pray it doesn't kick me out.
It did kick you out again.
Okay, so I'm not kicked out. I'm here. I just stopped my video, so I'm okay right now.
We can see it.
I'll take like 10 minutes. Let me redo everything here, my setup.
Oh. Oh, where are we? It's 5 minutes, so come on.
We're still here, you guys. Just want to make sure you knew that we're still here, and I'm like halfway set up. Heather, are you muted?
I am.
Okay. I saw like your mouth moving, but I didn't hear you, so I just want to make sure.
I am. I had a whole conversation by myself over there. Okay. So Anne Marie says, I see it as you're not using light-based or pulses. It's RF, not really a loss of, not a loss really as a business owner consumable wise, which is true. So very little consumables used, and just good practice. You want to keep these people happy during this time. You want to make sure that they know that you care. So I think that it's an important thing to do. But again, it's your business, it's your practice, and you know your patients. So I would take it as a case-by-case basis. Any other questions? You can unmute yourself or you can write in. Anne Marie, go ahead. You can unmute yourself.
Hi, I'm sorry. I'm kind of late to the meeting, to the training. I just had a really quick question. I haven't, I'm fairly new. My doors opened in January, and then of course the pandemic, right? So I have not done too much as far as selling the body contouring, but my quick question was, as far as pricing, is that something that you're still sticking to like zones? And, maybe as they add more zones, you deduct the price. I mean, how do you really feel a lot of med spas price it?
That's kind of a tough question, just because we're all over the place. We're not just, in one central location.
Oh, that's
we're all
true.
over
Yeah.
the US.
I'm New York, right?
You're in New York, right? So even pockets in New York might be different. And so we actually have a really great tool for you. It's a pricing tool that we went over at our practice development webinars, but we also can get that information to you. It's just a low, medium, and high national averages of our prices.
That's right. Okay. Mm-hmm.
Yeah, so we can get that to you. And what we usually say is that you can kind of relate it to the Botox that you do if you're an injector, or if you have injectables in your office, or if you have, in your direct location or around you, say Botox is $9, $10, $11 a unit. That's probably your prices are going to be probably on the lower end. 12, 13, 14. That's kind of in the middle.
Well, yeah, we're kind of like anywhere from maybe 15, 16 up to like 18 at times.
Okay, so you're probably closer to the higher end. And I was gonna say, if you're right in the city, then that's probably where you're at.
Okay, I was thinking about anywhere like 300 a zone, more or less, 250 a zone.
It depends what you're doing and what you're talking about, right? Because these are platform devices. We do so many different things.
Yeah, I'll take a look at that pricing. I don't want to hold you up.
Oh, no, that's okay. Yeah, we can get that to you.
Okay, great.
Any other questions? I'm pretty sure if you're talking about contouring, what we just did, then you're closer to like 300 to 350 per treatment zone.
Gotcha. Okay. Thank you.
You're welcome. Anyone else? Is everyone doing treatments on themselves while we're doing this? Not today, but during this whole quarantine.
Yes, I have definitely. I was just thinking, just thinking of a question there now, and it's just gone out of my head for one moment. Yes, that's what I want to ask you. So for clients for the ST, over 60, so say 60s, early 70s, 6 treatments really isn't enough, I feel. What would you feel about that?
It depends on the person. I always take that as a case-by-case scenario, but I agree that the older the client, the more treatments they're most likely going to need. So I would say that that's a good thought process to have in your head.
What I feel is when I finish the course, I don't feel they're getting a full year out of their result. Yes, they're getting a good result, but I don't feel myself that it warrants a whole year.
Do you have them do maintenance treatments every 3 months?
Do you know, I do. But even with that, with the maintenance, I think it's fantastic.
Mm-hmm.
And the result is super. But I still feel it could be better. So I'm kind of wondering, should I really bring up the treatment plan instead of 6, bring it up to 8?
I agreed with that. Yes. I also think that maybe what you could do is try to sell packages of 10, because so you do your 6 treatments and this particular person is looking fabulous. Okay. So now they have a lot of maintenance treatments. They need 8 treatments. Okay. So now they still have more treatments as their maintenance treatments that are already prepaid at that lower price. So the selling more is always better. Because you're going to have that ability to use them as maintenance treatments should they be happy with their results after 6, after 8.
Okay. And the other question, just we didn't go over today, obviously, because you weren't doing the neck. Are you going to be doing the neck again?
Not today. Are you talking about V-form on the neck?
Yeah.
Or like the submental area with the V-form?
Yes. I'm actually talking
about it. I can talk about it. We're not going to do it today, but I can talk about it.
Sorry.
You know,
I did do it just so you can go back and watch one of the webinars. I did it about a week ago. So if you go back to the Viewer Online Academy, you can view that. Yeah, yep.
Thank you.
I'm almost set up, you guys. I was just trying to figure out how to like get my leg up into the camera, and I think I figured it out. Let's do a quick quiz, and I'm putting the filter in right now. What filter do you think I would be using on my legs for hair removal?
Where is she? Where are you?
It's 6:30. 6:30. Great. That's what I'm using. Good job. Okay, so let me figure this out here. Okay, let me start the video. Let me see what I'm looking at here. Ah, what do you think?
Yay!
Pretty good. Pretty good. Okay, so I'm just gonna pause this really quick, and I'm gonna get it set up here. Okay, so I have the 630 filter in. I'm logging in. Okay, another quiz. What pulse configuration will I be using on myself?
Single pulse.
Hey.
And my hair follicles, my hair on my legs, I've never done laser hair removal, but they're not all that dark. They're kind of, I'd say medium color, medium to fine thickness. And I have an option between, sorry, the handpiece is still cooling down, so I can't see and I can't remember.
Kara, we can hear you, but it's going in and out. So I think if you like lean back, we can't hear you very well.
Got it. Okay, sorry, I was looking at the screen. Thank you for that. So my hair follicles are medium thickness about, and fine to medium, I'm sorry, they're about fine to medium thickness and about medium in color. And I have a pulse duration option between
The handpiece is still cooling down, so I can't see. You remember what the pulse duration option is for the 630? Is it 10 milliseconds to 50 milliseconds? No, it's 20 to 50 milliseconds. That's my option. So do you think I'm going to be closer to 20 milliseconds or closer to 50 milliseconds?
Closer to 20.
Closer, yeah.
If they were coarser, you would probably go, you want your milliseconds further out, like closer to the 30, 40, right?
Right. Yeah, yeah, very, very good. I'm going to be kind of right there in the, a bit in the middle. I'm going to,
Heather, we can't see Cara, so you're on screen. Has she switched her mode?
I haven't turned the screen on yet just because I'm like crouching down.
So I can't see Kara either because I'm not.
No,
I'm not
okay.
Yeah, I can't see her either. When
No,
she's
you don't want
asking
to.
her
You do not want to see.
Fitzpatrick.
You don't want to see me right now. I promise you. I'm just setting the settings and then I'm going to turn the screen on. So
Is her Fitzpatrick like a 2? I can't see her.
Exactly. I'm a Fitzpatrick 2. So I'm going to be in single pulse. And then my pulse duration, I'm going to do at, I'm going to test at about 35 milliseconds, just kind of right there in the middle, just because my hair follicles are, medium color, about medium thickness. So just for safety, I'm going to start at 35 milliseconds. And my default joule is 16. So I'll just start at the default because that's what it gave me for a skin type 2. So I'm going to turn it on and I'm going to turn the screen on.
Mm-hmm.
All right, so now I'm on.
Right now, yeah.
No,
I turned it off.
We can't hear you, Kara.
Oh, you can't?
Oh,
Oh,
no,
yeah,
I
we
can't.
can now. We can.
Oh, okay, good.
We could see you too.
You can see me, right?
Yeah.
My handpiece is so beat up. I almost asked for a new one. Probably work.
Kara, we can only hear about every other word that you're saying.
No, it's because I'm far like you were.
I think it's when you come in. I think it's when you come in. We can hear you.
Yeah, like right there we can, but I don't know if you can actually treat that way.
I won't be able to treat that way. So Heather, why don't you do the talking for me then?
Okay. So are you what jewels are you at? We couldn't hear.
Oh,
Were you
sorry.
at the default jewels?
I'm at the default jewels, which is 16.
Okay.
I set the pulse duration right in the middle at 35.
Okay, great. So your hair removal default jewels are going to be pretty spot on. The one thing you really want to be careful with is the configuration. So if you're treating somebody that is a 4, 5, 6, then the default is going to be on a single pulse. So you want to be very, very careful with that you're paying attention to changing that. However, your duration, your pulse duration, and your joules will be set pretty safe should you put in the right information at the beginning when it first prompts you. So she's putting on a nice layer of ultrasound gel. You don't need as much ultrasound gel as you would need with ST. And you want to place the handpiece on the skin. Pressure feels better. Remember this, there's a cooling aspect to this that is going to feel even better if you put that little bit of pressure there. But again, not as much pressure as ST, just really placing it on the skin.
Can you guys hear me?
Yeah.
Yeah.
I always pulse in 3 spots. So it's pretty much like this. So I did 1, 2, 3 with a 10% overlap because it gives me a better assessment of what kind of heat am I going to really feel. It kind of gives a good assessment of what the build on heat is going to be. Additionally, it gives me a larger area to assess. What kind of heat do I feel or does your patient feel? And what kind of redness are you seeing? When you just pulse once, it's just really hard to assess. By the way, I had 0 redness, like absolutely no response. I didn't feel it. I don't feel anything lingering. And remember, that's what's important is the lingering sensation. So if you're at that case, like 0 redness, I'm going to go up by 2. So I'm going to stand up. I'm going to stop. Every time that I stand up, I'm going to stop my video because it's a disaster. Because I'm on the floor.
Oh my God, this is so cool.
So she's pulsing 3 times right next to each other, you know, with that 10% overlap, and then she's assessing. So this is really important. This just testing in general is very important, especially the first time that you're ever treating somebody with IPL. One, it's for safety, but also for efficacy. Because if she were to treat her entire leg right now with the recommended joules and duration, she would have had to change the settings and go over the entire area again, possibly even 3 times, which is very time consuming. So you're actually saving time by taking more time to test.
Yeah, add like 15 minutes onto everybody's first treatment, and then you have their perfect parameter, like Heather said. I felt a little bit. I'm at 18 joules now, so I went up 2. I felt that one a little bit. I'm looking at it. There's really no redness. I don't feel anything lingering. I don't really see anything. So I'm going to go up 2 more joules.
So what Kara is looking for is something called perifollicular edema or erythema, which is just redness around the hair follicle. She doesn't want to see angry red skin. The entire area should not be red and angry. Really, you're really looking at the hair follicles themselves. Sometimes if you have a dark hair, you can actually see like a singe to the hair follicle, or the follicle actually pops out from the root. Those are all great responses. Also, another endpoint is the smell of burnt hair. That's a great endpoint. So she's looking for some kind of endpoint to know that these are the right parameters for her. Maria asked, what do you mean by proper configuration? And our pulse configurations on our device, something that makes us stand out from other IPL devices and makes much more safe and effective treatments is that we have different pulse configurations. So we have a single, a multiple, and a rapid. A single pulse is really just for skin types 1, 2, and 3. It's all of the energy delivered all at once in one pulse. The multiple is going to be the same amount of energy but divided up into 3 pulses with time off the skin between. So it's going to be safer on the skin for darker skin types and a little bit less uncomfortable. Then our rapid is for skin types 5 and 6, and this is all that same amount of energy but divided up by 10 subpulses. So little tiny spikes of heat and then just as much cooling right after each pulse, subpulse, excuse me. So it's very, very safe for dark skin types. So this allows us to treat all skin types, which is huge, that we have a larger clientele that we can choose, that we can treat safely and effectively. So because she's a skin type, 2, yeah, Kara?
Yeah, I'm a 2. By the way, I just smelled the tip. Because that's my endpoint, right? I want to know if I have the smell of burnt hair, because I really did feel that one quite a bit more.
What are you at, 22 joules?
Exactly, I'm at 22 now.
So because Kara is a skin type 2, we are treating her with a single pulse. She's gonna get the most efficacious treatment with a single pulse. And she would not need to go up to a multiple.
Okay, so I still don't have redness, you guys. So I do have the smell of burnt hair though, so I'm only gonna go up 1 joule just because I'm getting kind of close and I don't wanna go 1 joule too high. So I'm gonna go up 1 more, I'm gonna be at 23.
Any other questions? You can unmute yourself.
And I haven't adjusted the pulse configuration yet. So I will do that though if I have redness, but still, you know, I don't have that perifollicular, that redness, those little red dots around the follicles, or if I don't smell the burnt hair really strongly, I'll decrease it to 30 milliseconds.
All right, okay.
Let's say you're at the point where you're close to the end of the treatments and they have only a little bit of hairs. and you're at the highest, you know, at the highest joule that you can go and the lowest pulse configuration. So what happens then? Like, do they just keep coming in and eventually, because you can't go any higher or stronger than that. So eventually it'll target those hairs and
you'll just do an additional pass at that point.
Okay.
To build more heat.
Got it. Thank you.
Yeah. It's pretty rare too that I can go up at that high and that somebody is still not getting great results in 6 treatments.
I have a quick question.
Sure.
This is Anne-Marie. I'm pretty experienced with as far as laser hair removal. It's probably about like 14 plus years, and I've worked only really on diodes. But so this is like my first IPL for laser hair, and I have to say, I mean, I feel very confident when I do the treatments, and I always get the end point, and I get the smell of the hair, and I do get the erythema. I'm also getting like clients with like, I'm talking full hairy chest come back and like, I already have a grid after one treatment. Like they already have really great reduction. And then I get to put, and now I'm selling in series of 6.
Mm-hmm.
And the funny thing is, it's like after 2, like, do I really need to come back? So I'm almost thinking, am I being too aggressive in getting them the results where they're not going to have the need for all 6, or you don't see that happening?
Because of the different hair growth cycles that you're going to have to treat, you have the background in hair removal, so you understand the whole concept that
right.
You have to hit all of those different hair growth cycles, or it may seem like they're not getting any hair growth, but eventually they're going to get, and it comes back.
Right, it's almost like a shock and awe right now, and that I just want to make sure it's still like the same rule of thumb, even with it being IPL.
Absolutely.
Okay.
Yeah. And you did say that there's like a grid-like pattern, which can happen. So I don't want you to, be too down on yourself. But if you're seeing that a lot, then you probably are needing to do a closer overlap of each actual pulse. And if you're having a hard time with that, because I know you're going from a diode to an IPL, which is more of that stamping technique, then use a white skin marker.
Pencil, yeah,
Mm-hmm.
the eye pencil. But the thing with him was, I mean, he's really, I'm talking, it's like before I shaved him, it's like 4 inches thick. I mean, I'm talking like hairy. Like,
yeah,
it was a response where I went very close to 10% overlap. He also was a Fitzpatrick 3, but he was so uncomfortable, I guess, because the hair, A, there is a lot, and B, it was coarse and dark. I ended up going to, I'm not in front of my device right now, but I ended up going to not the single, but I guess the rapid, or not the rapid, the one between.
The multiple, yeah.
Yeah, and it was a little bit more comfortable for him.
Yeah, that's perfect. That's exactly what I would have done too. Perfect.
Okay. Thanks.
Cara, so you know what, that's not, I've no children in the background, so I'm not sure what that is. When you said you got the smell of burnt hair at 23 joules, and then if there was no redness, no peritibral edema, you reduced down your pulse duration. Are you going to reduce your joules down from 23?
No. So since you guys have been talking, I've been testing. Yeah. And I ended up going all the way max joules. I am very, very fair. I may be even teetering on a skin type 1. But I'm at the max energy. And then I drop my pulse duration down. So now I'm at 25 joules and I'm at 25 milliseconds. So first I adjust my energy till I get some redness to the tissue. And then I start dropping my pulse duration down until I get like the strong smell of burnt hair or the little red dots that I'm looking for. A lot of times the little red dots are delayed. They can happen an hour after we get off this webinar. So if that's the case, I'm just gonna look for overall a mild sunburn sensation. So I want myself to feel some lingering heat and to smell that strong smell of burnt hair.
Okay, cool.
Can I ask a quick question? In speaking of skin types, how you went from a 2 to a 1, would we question at this point if the hair has enough pigment to be a candidate for laser hair removal?
Her hair has pigment. It's a brown. Yeah.
Oh, okay.
I mean, She has she's definitely more of a brown than a blonde.
Okay.
So not on her, but on some people that may be the case. But
yeah, I mean, sometimes I find even a red undertone is tricky. You don't get such a great result with that. You know?
It is for
Reddish
all
brown.
hair removal. Yeah, it is. It always has been. I find that if it's that red brown, then it could have the potential. But if it's that strawberry
Yes.
blonde, it's usually just not. They're not great candidates.
Yeah. I also find, guys, and I'm a little bit older, like we get a little bit more gray as we get older. So sometimes I do a wax patch test and look at the hair root and see is there any color from underneath the skin down. So sometimes when you're not getting results, you kind of think, you know, how much gray is in the hair, and like the surface hair is brown, but the underneath is gray. So it could be gray.
I've never heard of somebody doing that. The only
That's actually clever.
It is clever. I wouldn't do it on every person because
no, I don't.
You won't be able to treat over that area for a month plus.
Yeah, no, it would be bring them in. Great idea. Bring them in another day and just
That's
think.
Great consult.
So smart.
Yeah, because I kind of think sometimes when I've done skin rejuvenation and I see more redness around the hairline, if they've just had maybe their hair dye done that week, there's more pigment in the skin. You know, like if they've just had color done.
If it's more sensitive.
Yeah, and you see more redness. So obviously, like I always kind of make sure they haven't had their hair dyed or bleached.
Yeah, because they've had almost like a chemical exfoliation.
Yeah.
Woo! I got some strong smell of burnt hair now.
So Cara, what are you at now?
I'm at the max. So you know
what are you at max? What's max again?
So max is I'm at 20 milliseconds and I'm at 25 joules. And you know what? I think I'm going to try next time the 570 filter.
I would agree. That's what I was thinking too.
Yeah.
I think if you're lighter, isn't that right? Your hair is lighter.
Yeah.
570 is better.
Exactly. So I think the 570 is going to respond better for me. And you know where that's a positive too. I mean, the 630 is definitely working. Like this setting, it's strong smell of burnt hair. I'm feeling the tingling. I'm feeling the mild heat. So it works, but I just think 570 is going to work better. And the positive of that is that I have a lot of hyperpigmented spots on my legs too that I hate. So it's going to help pull those brown spots a bit better too.
Cool. Yeah. Right.
So it's kind of knocking out both, you know, two things in one.
I have a quick question. I jumped into this meeting a little late. I caught the end of body contouring. Did you already review the IPL as far as photo rejuvenation?
We did that last week.
Oh, that's okay. I missed that. Is there a video to watch on that?
Yeah, there is. Yep. Online, if you go to Viora Online Academy where you register, any of the videos from the past, you can watch.
Okay. I mean, I had an excellent trainer, just that again, from the way I learned to now how Viora does it, it's so different for me because I don't want to confuse anybody, but I always looked at the 30 as just vessel, but it's, vascular, but it's not the case.
Yeah. So I covered that last week, so you can watch that. Who was your trainer?
Kristen. She was great.
Okay, good. So yeah, you can watch any of those past ones, and I'm doing you may not have the Indie YAG, but I'm doing Indie YAG skin rejuvenation.
I have the YAG in office, and as well as the resurfacing.
Nothing like working from home. So the Indie YAG skin rejuvenation I'll be doing next week, so you should join that one too.
Okay.
Sherry, your little monsters are loud. I muted ya.
So, Cara, just to say to the group, we talked about this last week. So you patch test, get your endpoint, and then you do your pass over again, don't you? You treat the whole area again.
Yep.
Kara, are you talking? You can't hear you.
Sorry. Yeah, I asked if you would answer that question, but you couldn't even hear me say that. So I was just kind of wanting to show a bit of the technique. But yeah, anything that didn't respond, I would then treat over. So the only area I wouldn't treat over is where I found my perfect parameter. So I'm going to show you guys a full row and, you know, like your overlap, because this can be deceiving. There's a lot of plastic surrounding the actual light. I wish you guys could see that better, but you can't. Mine isn't on. Oh, there you go. Yeah, if you can get close to the camera. So there's a lot of plastic surrounding it, so it's kind of deceiving. So I'm going to do a row so you guys can see the overlap. I tend to treat like Kara is and put gel in areas like, so I'll do one side of the leg and put the gel there and treat that whole area, and then I'll actually scrape it and move it because the gel does dry. So if you were to gel up the whole entire leg, by the time you got to the other side, it would be dried up. So that's how I usually go about the legs.
Heather.
Mm-hmm.
Hi, it's Shari. So there's times where I feel like 6 treatments, you see it definitely a significant difference, but my clients, most of them need more than that much. And I don't know if it's something I'm doing wrong, or it's because also with the cycles of hair growth, I thought that, you know, even though, you know, because maybe after the 3rd treatment, they don't have hair and they're completely blown away. And then I tell them, you're going to have more hair growth. It's going to come in. You'll probably need more than 6 treatments. But because you said before that after 6 treatments, you see that, like, I don't remember. You said something about 6 treatments where it made me think that maybe I'm doing something wrong. Because
no, not at all. I'm sorry. No, I don't want you to think that at all. It's 6 to 10 treatments always.
Oh,
this is
okay.
Average. 6 to 10 treatments is average. So just remember that when you're selling them, I like to tell people that you could need up to 10 treatments and take that 6 number out, because when you say 6 to 10, they hear 6. It's just how people are. So I say you could need up to 10 treatments, and I sell them in packages of 6 at first, and then we go from there. So that's kind of how I word it, a little bit differently than just selling packages 6 and talking about that number 6. They're going to need at least 6 treatments is another way to kind of look at it.
I also,
what do you tell them? Oh, sorry.
Sorry, no, I'd rather you finish. Sorry.
I'm sorry. So after the 6, do you usually have them buy another 6, or do you break it up like a package of 3? Because, you know, especially with the legs, it's very expensive, and sometimes I tell them anyway, you know, you can use it as maintenance. My packages don't ever expire anyway. But what do you do? I'm just curious.
I sell them a maintenance package of 3. And they can always use that on different areas should they want, like, say, so they come in, maybe they need to come in once a year, and they have their 6 treatments, they're super happy, and then they buy a package of 3, right? So then they do their first treatment that year, and then they say, you know what, I kind of want to try my bikini line and my underarms. Okay, so then I can apply that 1 treatment or 2 treatments or whatever, however many they have, to that next package. So I always like to oversell in regards to that, because there's always going to be other areas that they want to do, and if they don't, then they can always use them yearly or every 6 months as maintenance.
Just to give a little bit of what I've been doing here in New York, I actually came up with like a pricing system. Like sometimes you'll get somebody that comes in, oh, I already did my legs at such and such, I'm done, but I just need 1 or 2. I personally don't like them coming and getting a one-off, because then they're like, well, you didn't get me results after 1. So that's why I always keep a package of 3, and then I do a package of 6, a series, I should say. And when I do a series of 6, I always say to them, I always put in 2 touch-ups. Now, you may not need it, may actually be, it's full treatments, but some people at that point, if they feel that they're great at that 6th treatment, then they could come in over that 6-month, you know, wait 2 or 3 months and then come back, and then I can reassess with them not shaved to see where they're at.
Just make sure you're building those 2 treatments into that original package, so that they're, you know, you're not.
But they think they're getting more, but technically that's the pricing. Yeah.
Yeah,
that's a great idea.
That's great.
Just wanted to say that.
I also do a single pricing as well, because sometimes men with back hair, it's like, and everybody's different what they consider being done. Like so I've had clients where like they want to get like their mag lamp and they want to like stare at their kneecap. There was one here this morning, you know, you get those and it's like, you know what? Then I just say, don't shave. And we're going to just, I shave at the appointment. I spot treat, put the gel, I treat it, spot treat, gel, and I'll do it that way when I get to that point. And I also started charting years ago with some nasty clients. Are like, I can't believe it's my 5th one. I have no results. So I wait till about their 3rd one. And I could be wrong and correct me on this, Viola wise. And I'm like, so if we had to decide like percentage wise, where do you think you're at? And I try to document that because then they could be like, well, I didn't get results. And they're telling me this at treatment 6, where at treatment 4, they were like, I'm at least 80% great. Like, you know, so it's kind of to save yourself from them being, you know, their word against really what you've asked them in the past, you know?
No, it is smart. Just like before and after photos, anything that you can properly chart, before and after photos, like you just said, asking, anything you can chart to have yourself
to go back,
right, have yourself covered is so smart. Not only for
only
you being covered, but for their happiness.
Yeah, totally. Yeah,
Say
and again, it just, I think it also shows that you're showing that you care, and you know, you want to make sure that, you know, hey, let's take a look and see if it's really not necessarily the settings. It could be, did you have any hiccups with going on a cruise, or you're away in London, or you know, there's those, their lifestyle plays into it too with the commitment.
Absolutely. Very smart.
I'm sorry. Blazer's my passion. Laser hair removal's my passion. That's my
good.
I could like live my whole like practice just on laser hair.
Good. I love to hear that.
A lot of times people don't think that they need to take pictures with laser hair. And I do not agree. When somebody comes in, especially for a consultation,
always the before. Always.
Yes. Even if they've already shaved, you can zoom and you can see the actual follicles.
Absolutely.
So take a quick picture, because when you pull that up next to their after, they're going to be blown away.
Yep.
Yes.
Yep.
I actually call that sometimes on the lower legs when women are really like, if they get the chills, you ever see like women when they get the chills, you see like those little black dots? I call that like the vanilla bean ice cream. They have bare legs with the black dots. So when I photograph that, and then at their treatment 5, and you compare, like, it's such a, just the pore size alone, the follicle, you could tell that the hair's thinner and they're responding.
People forget too. They forget how often they used to have to shave.
Absolutely.
They forget how many follicles, you know, some people, I've seen people with 2-3 hairs in each follicle, and then they're at the end and they're shaving once a month, and they have like 5 or 6 hairs and they're frustrated, and you're like, you're like, this is life changing. This is so different. But they get focused on what's left there. So
I also think it's kind of across the board, because same thing happens with pigment. They're like, but look at this, look at that. Okay. And then I love pulling up that 3 or 4 months before, where it was like total, like just muddy everywhere, the complexion, you know, because they forget, you know, it's like the same thing.
Before and after photos are everything.
Critical.
So critical.
They're good to have in your before and after book too. So even if the person's super happy and you don't see them, you know, they're coming in once a year or less for maintenance, to have that book of, look at this underarm, look at this bikini line, look at this lower leg, and look at the difference. And these are actually my treatments. That's really important.
Yeah. And also, I also think, you know, we forget every day we age again, you know, so clients, you know, what I always like to ask a client, what would you want me to achieve for you? Where do you see yourself in 10 years? What do you want me to achieve for you? What do you want to look like in 10 years? So every day we age, external environmental issues, internal aging. So of course our skin is going to change structurally, inside and out. We're not going to look the same at 20, 30, 40, 50. We're just trying to look the best we can at 30, 40, 50.
Exactly.
Yeah, so cool.
Yeah,
I love this.
That's what people, they ask, how long do the results last? And, you know, I can't even answer that for like a facelift, you know, like if someone got a facelift at 50, when they're 60, they're still going to age. You know, that facelift isn't going to make them look 50 forever. It's what you just said.
Yeah.
It's making us look the best we can at the age that we're at.
Agree.
Yeah.
I'm just looking through some questions here. Okay, so we had one, how frequently should this be done? I think she was referring to hair removal, and that's just really dependent on where you're treating. Legs would be about every 8 weeks.
Oh, see, I bring them in at 6. Maybe, I guess I shouldn't.
8 to 10, actually.
8 to 10,
Really?
I would agree. I would agree.
But okay, so I'm just gonna I know this is irrelevant, but like I was on an 810 diode, and at 6 weeks, like they got tremendous results. But I guess I'll push it out. I mean, even men's back.
Well, yeah, it just depends on where you're treating. So like underarms and bikini, and like hormonal chin hair or man's neck, that's great for every 6 weeks.
Right.
Legs, and you kind of think of it like this: how long do specific hairs get in an area? So if I didn't shave I don't shave my upper lip, but let's pretend like I shaved my upper lip and I just let it grow, the dark hair, it's not truly going to get very long. Why? Because it sheds very quickly. The anagen phase doesn't last very long on my upper lip. So you can treat the upper lip every 4 weeks because it's a quick anagen phase. But leg hairs, if you let them grow, they'll grow and they'll grow long because the anagen phase is so much longer. So really and if you were doing every 6 weeks, it doesn't mean that they weren't going to get a result, because they were. It's just not as many of the hair follicles are at the anagen phase as they could be at 8 weeks.
Okay, so now I would think, see, now this is great because I don't want to mess anybody up on the call. For me, I felt like Fitzpatrick 5 and 6, I would push them out. I don't know if that even is irrelevant or not. Like I would push them out due to the darker skin tone and dark hair. But anybody like a 3, like an ideal laser candidate with dark coarse hair, I was bringing them. Okay.
But
it's more
everybody's
about
hair.
the anatomic site.
Yeah, it's more about your own individual hair growth cycle. So
yeah,
I think the good rule of thumb is I tell my clients, okay, if you're at 6 weeks and you see half a dozen hairs, you know, maybe wait 2 more weeks and there might be twice that on the surface.
Exactly.
So you're looking. Yeah.
Yeah, I guess a lot of times it's, you know what, it's getting
the rule of thumb is the more you see on the surface, the better it's to treat.
Right. So for me, I tend to sell multiple parts. So if they're doing like a full Brazilian and lower
But
leg.
I also think that, you know.
Oh, and you're wanting to like just
because a lot of them are like, oh, my child's getting out. I have tennis. So it's kind of like, you know, you want to. So for me, if that means I have to comp them an extra 1 or 2 to appease their schedule, I do that. But I would let them know, you know, it's not ideal. Same thing with lip. Like everybody wants to do underarm and lip, or like bikini or navel area and lip. And it's like, well, really your lip should really definitely chin hormonal every 4 weeks. But they're willing sometimes, well, I'll let them go the first 2 or 3 sessions with that 6 week mark. But if they're telling me the reduction is like truly not where I want them, then I explain to them, hey, you know what, we need to separate this. It's not ideal.
What do you do for, Heather? I know you do a lot of hair removal. What do you do for those busy clients?
I just treat them. I usually will kind of split them up between 4 and 8. So if they're doing their legs and their bikini, then they would just do their bikini. Their legs every other treatment. So yes, they would need to come in for more treatments, but they're going to get the best results in the least amount of treatments. And you don't want to waste your time or theirs by doing a treatment and not getting those great results. So
that's actually very smart. So you're on the 4 week schedule of like any upper face, you're saying when you come in, every other treatment will do the legs.
Right.
I think that's
so then you're at 8 weeks.
I
for
like
that.
that.
But you're at 4 weeks for the underarms, bikini.
I like that.
Like that.
So this eliminates any 6 week window whatsoever. It keeps it even between 4 and 8, right?
What I like about booking them at the 4 mark is that you have 2 weeks. So if their child gets sick and they have to reschedule or cancel or whatever, then you have 2 weeks to kind of, you know, move it. And also with the 8, so they have 8 to 10. So I always book them at that 4 or 8 mark. And then I also tell them if they're not seeing any hair growth that they need to call me a few days before, and then I'll push them out.
Absolutely.
That's actually excellent. I'm going to do that now because I'm actually, when this pandemic's over, I'm actually I came up with like a little stimulus package with gift cards and laser hair packaging. So I'm going to definitely be selling a lot more laser, I think, with that. So
can you share that, please? When you get a chance on the chat, maybe?
I'm a brand new business. I did all construction last year. And I didn't get a chance. So for me, I stayed in the area where I worked for years, and people that know me, I'm creating like a stimulus package for my business, so that if clients are going to buy gift cards, they're going to, and because they're going to be too scared to come in, if they purchase one for $75, I'm going to give them $150 value.
Oh wow!
$200, I'll give them 3. Like I'm staggering my gift cards accordingly, because I just feel like it's going to be very hard to see traffic in the very beginning, even by appointment only.
Yeah.
Especially here in New York. I'm in the heat of it in Westchester. Like it's
right,
bad.
exactly. It's where you're at.
Yeah, it's bad.
I do agree, but I also think that people are dying to get out too, and they're dying, and they're doing all this research on you know what they want to do when they're done. You know what bars and restaurants they want to try, and this and that.
I know.
So
I'm
they're
quite
doing a lot of
annoyed.
it, so. Yeah.
I just got to try to pull away from those hair salons, because you know those hairdressers are definitely guaranteed business when they open their doors.
I know. I know. I need to go to mine.
Oh my God! I'm so glad that you can't see us all, because I have so many roots. It's unreal.
That's the new look anyway.
It's really funny, Cara. Because I'm from Dublin, but like webinars and stuff, and you go and see people that go and talk about the the biological end of hair removal and stuff. But one thing I did come out of a webinar, which is, maybe we've discussed this, but and I do agree with this, that this one of this laser protection advisors said that he doesn't agree with treating the whole body at one time, because actually you can actually cause hair to stay in a stage of growth if you create too much heat in the body. So he was saying, like, so if you treat underarms, bikini, legs, the whole body, maybe sometimes you can actually cause like a shock to the body, and the hair stays in actually the intermediate stage, like telogen. You can keep the hair not going back into anagen for longer. I thought that was so interesting.
That is interesting. Wow. You know, I'm just thinking about that 8-week schedule too. It's kind of nice where like people always worry about like, I can't buy laser now because the summer's coming. It's so not true, because you missing one 8-week appointment is not the end of the world. You know, likelihood of you getting sun anyway, and even sun-kissed color, I'm not going to treat you. So.
Right. We've found that the best results when you have to take a break is to at least get 3 treatments in. Yes. And then you can, it's not ideal to take a break, obviously, but if they go on vacation or it's the summer and they just really cannot get treated, then after those 3 treatments, so I like to push people to those 3 treatments. I'm like, wear your sunscreen, get 1 more in, just stay out of the sun for a little bit longer, and I get those 3 in, and then I can push them out. So that's a good thing to talk about right now. Like, let's get you in, let's get some treatments in.
So you don't have to shave for the summer.
Right.
Yeah.
That's what they like.
That was a very good tip, by the way. Thank you, whoever told me about I'm thinking if I ever did it, but I mean, people just get so like, 8 weeks is such a long time. Yeah, well, you want results, or you want to see your money go down south,
Yeah, right. No, for sure. And they appreciate you saying that you're not just taking their money and doing it every 4 weeks and them not really getting many of the hair follicles at 4 weeks.
When I first started in the industry, which was like 15 years ago, I heard the same thing, that every area should be treated every 6 weeks, and that's what people were.
That's me. I'm like, that's me too, right?
So that's probably where you've learned that. But it has changed since we've really gotten into
technology,
the science behind it. Different areas do have different times that intervals.
And as you said, Cara, it is pulse duration. So I think years ago nobody really understood that.
It was pulse duration.
That's what it is.
But my last question is this: if someone's doing a full Brazilian, when are you bringing them in then? At 6 weeks with the underarms?
4. I would say 4.
Every 4, and everyone's different. Some people I can treat like clockwork every 4 weeks, 6 treatments. Sometimes it's 3 treatments at 4 weeks, and then they call me and say, I don't have any hair, and I say, okay, well, let's push you out a few more weeks.
Right.
Everyone's a little different.
That happens with underarms sometimes. If somebody has really dark coarse, like my girlfriend had come in, she's like, Emery, it's like week 4. There's still nothing. And I'm like, all right, relax. You know, I'll see you. And I was bringing her in at 6 weeks. But you know what? So now just to regroup, and I'm sorry to mess anybody up, but from the neck up, you'd say every 4. And from the underarms down, you'd say every 8. Every 8?
No. So anything that's more hormonal on the body, underarms and bikini, that's going to be 4 to 6.
4 to 6, yeah. It could be 6 though, if you know, but 4 to 6.
And then yes, the upper lip, the chin, again 4 to 6.
Back, man's back, legs, arms.
Okay, so then legs, back would be the 8-week mark, correct?
Yeah.
Yep.
And the bikini, how about like even like the back end around the buttocks, like inner, like that still goes with the 4-week as well?
It's still hormonal, so 4 to 6. Yeah.
And how about the butt cheeks themselves?
Like a Brazilian.
Like sometimes it's a rarity, but sometimes I get women that want their outer butt cheeks. They need lasering. Would you put that with like legs and back hair?
I would.
Yeah,
I would.
Okay. Hormonal is inner, the underarms and face, obviously, and neck would be 4 weeks.
4 to 6.
4 to 6. Oh, this is okay. Thank you. I can't believe. Again, I think it's just the modality I used to work on that I'm so used to. That's really what it comes down to. Got to get out of my head.
Sherry, it just depends on the growth phase. How quickly those hair follicles really, or how quickly most of them are getting back to that anagen phase to be able to get most of the hair follicles. So if you go to like the IPL didactic webinar, or even in your workbook, there'll be a chart for you, and just follow that chart.
Oh, that's great. Okay.
So I was just answering Sherry's question. Well, all right, you guys, this was great. I'm so glad that we had just a full discussion. I love this just because, you know, everyone's probably thinking the same things, you know, and it's great when we have people unmute themselves. It's my favorite. So next week we are doing Indie Yag hands-on, so that'll be good. And then my favorite one coming up is Heather and I on Friday, and we are doing a virtual event. So we're going to pretend like everybody that is on the webinar is pretty much our clients at our med spa. I'm going to pretend like I work with Heather and I own the med spa with her. And
that's great.
We're going to do a virtual event. So you guys can, you know, pick up tips and tricks if you want to hold your own virtual event for your clients. So that'll be on Friday. I'm really excited for that. Additionally, I'm not doing cocktails with Kara today just because of what I look like today and hands-on, no makeup. But next week, I am doing cocktails with Kara on Friday, and we have a celebrity guest. Super excited. He's a big time movie director, big time. And I've done treatments on him. So we're going to talk about his results, his treatments, and just his industry, like the movies that he's directed, the projects he has coming up. And we're tying that all in with Bjorn and his treatment. So we really hope you guys all join us next Friday for Cocktails with Kara on Instagram Live. And then our webinar is coming up next week. Okay, you guys.
You guys see my lips? They're so plump.
I know, they're so gorgeous. I'm so jealous.
Gorgeous!
So jealous.
Oh, okay. That's another thing. I have a quick question. Lip injections happen to be obviously very big in New York. That area, the lips with, you know, the upper and lower above it, like what would, I was looking to charge about $350 a session because they're paying about $175 per eye zone.
So for PlumpRF, it's about $300 to $500 per treatment.
Okay, so $350 is probably a good.
Exactly.
In New York, yeah.
Yeah. Oh,
Can I ask you a question about that? I'm sorry to cut you off, but so do you feel like it's worth it to do $350 a treatment on the lips? I mean, I'd rather pay $500 for a syringe. No.
Well, the problem is with my clients, a lot of them are like very more natural. They don't really want to venture in. They'll do the set. They have the money for a $750. Like in New York, we charge $750 for a syringe.
Plus, you're not really.
Oh, really? Okay, no, because when I do my lips, I pay like $500 for a syringe, and I'll do half at a time. So I'll do half, and then like maybe 3 months later, another half. So for me, I'm just saying, I guess if whoever's scared of needles or whatever,
It's also
But-
comes down to, I find that sometimes, I mean, there's great injectors for lips and you don't get the lumps and bumps, but I feel like they're so vascular and you metabolize the syringe so quickly that for me, I feel like it's kind of like it's one of the same doing it. I don't know. I feel like
Yeah, I mean, yeah, I
right.
agree. I agree. Everyone's different. For me, actually, I'm very lucky. My lips usually do look very natural and stuff, but yeah, that's what I was just thinking, like the whole price point. But okay.
Okay, so there's going to be a few answers to that. One, if people love their injectables, they're typically not getting it at $500. But even if they're paying up to $2,000 for their lips and they love it, then they're going to be clients for injectables. You know, it's not PlumpRF is not for every single client.
Right.
However, lip injections are not for every single client either. So this is where you get the maybe younger clientele that just want a little bit of a plump and they don't want it to look fake. Maybe you get older clientele that would never put injections in their lips and they've lost volume. They have deep lines that injectables are not going to be able to treat and the PlumpRF is going to be able to. So it's going to be kind of a mix. But if there's some clients that absolutely love their injections and they're never going to stop it and they're happy with that, well, then, you know, they're just not a PlumpRF client. Maybe they're a skin tightening client for their face, but you have other people that do want the PlumpRF too.
Got it. Okay, thank you.
Offer it is important.
We're doing lips every 2 weeks.
Yeah, if they're a little bit older than 60, it's better to space it out every 3 to 4.
Yeah, okay. But most of our average clients, so we can do it every 2 weeks for at least 6.
Some people
treatments.
are happy at 4.
Okay.
I would say 4 to 6. Yeah.
Yeah, 4 to
4
6.
to 6, and it should last at least close to a year.
Yeah, close
after
to a year. I mean, it could even last longer. But if they're getting maintenance every 3 to 4 months, you should really get long-lasting results.
Okay.
And you know what too, you could always come up with like I find with maintenance, I would always like kind of do some type of discount to give them incentive to want to do the maintenance. You know?
Oh, of course. Yep.
Oh, yeah. No, it's just so important too in a consultation, making sure they know that, you know, that these are not, some people kind of think, okay, these 6 treatments are going to make me look 40 and I'm going to look 40 for the rest of my
Angelina
life.
Jolie. Yeah.
Yeah, and that's not the case. So really teaching them in the consultation and why they need maintenance is going to be really important.
Yeah, I definitely think it's your client base. For me, I end up dealing with a lot of women that are like maybe mid to late 40s and older. So like they're at a point where they don't want to leave. They want to have something where, again, with the lips, you're able to go out and about the way your lips look great right now. Whereas if you do an injection, you're walking out with ice cubes, you're feeling like you know, plumpy and you know.
Yep.
There's no immediate, you know.
I'm spotlighting you again, Heather. Sorry. Because in the recording.
And then you know what too? There is women that are just not candidates for lip injections because they're kind of too. What's the word I'm looking for? I think they're not out at all. Like some people that try to attempt lip injections, it's awful.
Yeah, you'll 100% find people that even have contraindications to injectables too. So it's always, you know, it's something that it's another tool that you have in your bag, which is great.
Yeah.
What I love is that because I love lip injections. I'm not against them whatsoever. I haven't had them in a long time, and I'm excited to get some soon. But I've found that if there's somebody that already gets lip injections and then they do PlumpRF, it's even better. The results are even better. So in conjunction, it's
exactly
a good idea.
It makes the injectables last a lot longer.
It also like really, really affects my vermilion border. Like my vermilion border looks so much better after I do PlumpRF. And that's a really hard thing to do with injectables on me personally, without making my lip look longer. So it gives me more of that lip flip. And then if I wanted to really plump up my lips and get a lot of volume, then I could always add more.
Then you don't have to put as many, like, you know, if you needed 2 syringes in your lips, you know, you're not going to need as much. And it's better for the injector too.
Right.
Heather, have you noticed it extend the wear actually of the filler? Like has it extended the duration of the fill?
Well, so it's actually been about, for me, because I've just been busy with babies in life.
Yeah.
I haven't had filler in about 3 years now. So that I haven't really done them both together. But I have noticed that I haven't like had the desire to go and get filler. It's kind of like prolonged how long I needed to do it. So
it will though. So for clients that do the series and then do the injections, it will give a longer lasting result. Yeah.
I do have a question in regards to the timing. So like, I know when people do Botox or fillers, I never use a light-based treatment on them. I make them at least wait, 2 weeks to 3 weeks, or at least 2 weeks for Botox, up to 3 weeks for a filler to do any type of IPL on their face. But when it comes to the RF for the lips, what do you recommend if they had filler and they came in?
2 weeks.
Like, 2 weeks?
Yep. 2 weeks. They can do it after 2.
Okay.
Yeah.
Is that anywhere on their face or just the lips?
No, anywhere. Any natural filler can be treated over after 2 weeks.
Thank you.
Yeah. You
But
know
would
what?
you would you agree with light-based though on the cheeks if they had filler that you would wait 3 weeks for that with the IPL? Up to or you think 2 weeks is still sufficient?
Why did I just draw a blank on IPL natural filler waiting period?
We say 2 weeks to a month. To a month.
Okay.
Because VFR we don't want to treat over filler because the temperature is so high. So IPL, our temperature is reaching to about 60-70 degrees Celsius. Filler can withstand really high heat temperatures. And I'm drawing a blank on the temperature that breaks down most natural filler.
That's okay.
But it's really high.
Can I ask a question though? I have a client right before the pandemic that's doing jowls and the cheeks with the ST handpiece. Is that bad? Like if she does filler, do I need to be wary of that? I mean, I know she doesn't, but if she did.
Yeah, I mean, ask her if she just got it, this last week. But if it's been
if it's like 2 weeks old, it's still okay. Okay, I thought you meant because it's 2, you can't do it, but you can with the RF. You just got to wait the 2 weeks.
Exactly.
Okay.
Yeah. But VFR, for the people that have the fractionated handpiece, that's when you have to be a bit more careful because we're getting into over 100 degrees Celsius.
Oh, that's what you had said. Yes. Okay, definitely. And that really the doctor only does anyways.
Yeah.
And is it wrong to think that theoretically the fillers could actually make treatment potentially better because they're hyaluronic based?
Do you
know what I mean? Just because it's
I mean, it absorbs. So like if someone has hyaluronic acid based filler in their lip,
yep,
it does plump quite a bit when you put RF in it.
Right.
So yeah,
it enhances it, right?
In that, yeah,
it enhances it.
But the collagen effect, like stimulating the collagen, may not be as effective, right?
Yeah, exactly. It'll probably be about the same.
So ideally, if we had a choice, we would try to do our PlumpRF on the lips prior to any filler.
Yeah, it's better just because then you don't need to use as much product when you're filling.
Okay.
Yeah.
Not to ask a question off the road, off the map here, but $500 for filler. Just curious, where are you?
Well, I'm coming.
What state? Where are you?
Long Island, I think, right?
Long Island. Is that cost?
No.
Like,
where are you, Sherry?
Somewhere in New York.
Oh, I'm in Rochester, so we're $750 for lip for one syringe, and then Voluma is $900 on the cheeks, one syringe.
Maybe she's not on here anymore. Okay, so
did you ask me something? Oh, sorry. Did you ask me something?
Where do you live?
I was asking about $500 for a lip filler. Where are you?
Staten Island.
Wow, is that cost, or is that cost out of pocket?
No,
She
charges that for, and it's Juvederm Ultra Plus or something like that.
Wow.
Yeah.
She's profiting.
It's not expensive. She also charges $10 a unit of Botox.
She's not profiting. She's not profiting, or she's not getting our product from the U.S. which is
Or are
fine.
you like a huge volume? And do you get, I mean, like I thought 438, 450 for like cost on a syringe is about what we spend.
Right. So she's not profiting, or she's getting her product from like Canada.
I don't know, but I mean, she shows me the box and everything when, you know, before she does it. So
Yeah,
I was gonna ask you if it's a
Yeah, no,
Groupon. I'm
that's
like,
fine. Even if it's from Canada, it's the same product. It's just cheaper to buy from Canada. It's illegal, but it's cheaper to buy. So it's the same thing. It's just illegal in the States. That's all. Or she's just not profiting much.
Jeez. See,
I don't know.
many spots like that just kill me.
Or she's buying it in crazy bulk through someone else.
Right. Like if you're a big Grace medical spa or something, right?
Right.
I mean, I know she's got a lot of clients, like a lot of people go to her. She only
I
works
could
in Staten
imagine.
Island. Yeah, she has
I'm
a
gonna
place in
drive
Brooklyn.
there.
She has a place in Brooklyn, and she's in Staten Island only one day a week for like 4 hours, and she is booked like completely. Like everyone goes to her in
Great.
Brooklyn,
So
Staten Island.
all the people that are quarantined in Westchester are going to drive out to her now because they're going to.
I'm not going to tell anybody.
Harry, you're not gonna get an appointment with her for like 4 years now.
Right? Everyone knows. It's the same as like people from Ireland, you know, on here. It's the same product. It's just not as expensive to buy it there as the States. So it's, you know, it could be, you know, just getting it from a different country. All right, you guys. So just looking at the time, we're gonna wrap. However, this makes me think that just a webinar of Q&A would be really nice, that we can just discuss everything and anything. And so let's do that. I'm putting together the next 2 weeks. So next week is already set, but then the next 2 weeks after that are not set. So that's what I'll do. I'll do a webinar with Heather and I, just purely Q&A, open up to just us discussing everything.
Yeah, and you could actually organize us by just going topic by topic, so we don't jump all over the place all over you.
Yeah, or we
open
could
session for IPL,
fine.
open session for
Yeah, so we'll do that. That'll be great. And yeah, we can just bring up topics. We can discuss them. We can just just have fun with it, pretty much.
Bring our prosecco.
All right, you guys. Well, thank you so much for joining this probably very funny webinar. Of us on the floor, us trying to do this on ourselves. I hope that it was beneficial and helpful.
Just really quick, the watch video, do I need to go into my Viora to get it, or do I go on the actual training site?
You'll go to the actual site that you signed up for this webinar. So VioraOnlineAcademy.com. You'll just click and you can watch any of the past recorded webinars.
Okay, none of this chat will be on there, right?
Everything will be on there. Yep.
Oh, even this part, the chat?
All of it.
Yeah.
All of it.
Lovely.
It's
Okay,
all
great.
good questions.
I know
Thank
that for
you
next
so much.
time.
Bye, girls.
Thank
Bye,
you.
Harry.
Bye-bye.
Bye, you guys. Thank
Thank
you so
you.
much. And we'll do a chat one in a couple weeks.
All right, and Staten Island, keep me posted on the $500 fillers. Your girl from New York. Take care. Bye.
Bye, you guys. Stay
Bye.
safe. Stay healthy.
You too. Bye-bye.
Bye-bye.